I thought it's well, you know those Chinese sticks that they put in the head.
No. It's my thinking then.
Oh, at least.
At least I'm thinking.
At least you're thinking. At least you are thinking. It looks good.
No, don't lie.
You know, since when you don't trust me?
No, I always trust
Testing.
Yeah.
Right here. Right. Where's that?
He's coming.
Can we ask everyone to stand, please? Can we ask the delegates to stand, please, for the minister? Thank you.
Inqungqulu yezombusazwe ike yasiza kwelakithi kwaZulu sike safika sonke sayimemeza yakwethu ike yabasiza yabatshela ukuthi izobanika okuphila uye wabaphilisa lapho bephile khona uye wakhala wathi mina ngizonibusisa uye wabanika isibusiso sokuthi bephile uye wabafezela ukuthi thina lapha kwaZulu thina seyinqungqulu zombusazwe uye waba inqungqulu wakhala ngaphansi sikaza khala sonke isizwe sathi khoka amathuba kodwa nkokahlophe wenza ngani uyawakhala umfowethu wathi mina ngizoyibusisa zonke isizwe ngakho konke mina ngafunda ngagogotha ngithena bogogotha nganika isibuzwe nganika isizwe izibusiso sokuba ngiyoziphilisa siyawulima siyakudla siyakudla okuphephile nalapho singaphephile khona siyakudla okuphephile wena winqwele endala heyakwethu phokohlophe winqungqulu heyombusazwe nalapho ufike khona uyofika ubusise isizwe esikhulu sakho KZN nalapho sebenze nabo bayojabula bebe isizwe esikhulu kakhulu lapho bayojabula khona
So you will call the
winqungqulu.
Right. Let's get everyone to settle down. Wow. Siyabonga Mbongi, siyabonga. Sanbonani.
Dumelang.
Molweni.
Reperile.
Ndimadekwan.
Goinand.
Good afternoon, delegates, and welcome to the 11th SAA's conference. My name is Dr. Gloria Maimela, and I'm the Director of Climate and Health at VETRHI, and I'm also the 11th SAA's conference chair.
And I am Dr. Tato Chidaregire. I'm the Acting Chief Director for HIV and AIDS and STIs in the National Department of Health, South Africa. I'm also the co-chair of the 11th SAA's conference. Thank you.
At this time, we'd like the delegates to stand for the national anthem delivered by the choir.
Hey, siyanamukela. Hey, welcome to KZN.
Welcome to
Hey, siyanamukela. Hey, welcome to KZN.
Welcome to
Hey, siyanamukela. Hey, welcome to KZN. Hey, siyanamukela. Hey, welcome to KZN. Ihawu siyanamukela. Hey, welcome to KZN. Hey, emasangweni ngenana. Hey, emasangweni ngenana. Hey, emasangweni ngenana. Hey, emasangweni ngenana. Hey, walaba hitilaba. Hitilaba. Walaba hitilaba. Hey, hitilaba. Walaba hitilaba. Hey, hitilaba. Walaba hitilaba. Hey, hitilaba.
Hayi we mama nganomthandazo. Hey mama nganomthandazo. Hey uNkulunkulu nomthandazo. Hey we mama nganomthandazo. Hey mama nganomthandazo. Hey uNkulunkulu nomthandazo. We mama nganomthandazo. Hey mama nganomthandazo. Hey uNkulunkulu nomthandazo. Ngingaze hey wamnandi ukubekeze mina ngingaze asuthi ngizohamba ngifikela wamnandi ukubekeze mina ngingaze asuthi ngizohamba ngifikela wamnandi ukubekeze mina ngingaze ngizohamba ngifikela wamnandi ukubekeze hey wamnandi ukubezela 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 ngingaze azothi ngizohamba ngifikele wamnandi ukubezela siyanamukela hey welcome to Lizul welcome to KZN
Siyabonga. Okay, thank you, delegates. Just checking the mayor Honorable Executive Mayor. Right. Yes, right. Thank you so much. Delegates, let me introduce you to the Mayor, Executive Mayor, Kolisi Kaunda. Has a rich socio-political activism background. Over the years, he has distinguished himself as a committed cadre of the African National Congress. He has served in various leadership roles in both the ANC Youth League and provincial structures born in Inanda. Over the years, he has distinguished himself as a committed cadre of the African National Congress. He has served in various leadership roles in both the ANC Youth League and provincial structures. Born in Inanda, north of Devon, he gained political consciousness early and became active from the tender age of 15. He was involved in student politics and youth political activism during the hard days of violence. Councillor Kaunda obtained his diploma in governance and leadership from the University of South Africa and advanced diploma in advanced governance and public leadership from the University of the Witwatersrand. From 2000 to 2006, Honorable Executive Mayor Kaunda served as a Ward 57 councillor in Inanda. Over to you, Executive Mayor.
Thank you very much, program directors. Honorable Minister of Health in the Republic of South Africa, Honorable Pasha, greetings to you and the collective, the deputy ministers present, the MEC for Health in KZN, Honorable Namakuku Smelane, all MECs from the provinces of South Africa present today. The Deputy Mayor of eThekwini Municipality, Councillor Mieni, and the Chairperson of Community Services, Councillor Sokabas, and all councillors present. Members of Parliament and members of the Provincial Legislature, Makosa Sendlunkulu, Professor Kollega Msana, National Laboratory Service, Mr. Nelson Mafu, United Nations, UNAIDS, Dr. N.G. Akera, Dr. Lamboli Kumboneke, HIV and AIDS representative, Southern Africa Development Community, Ms. Richana Ndlovu, My Voice Alpinism, The New Era, Comrade Steve Letzik, SANEC and National Civil Society Forum, and our co-chair of our AIDS Council in eThekwini, Dr. Nzimande, and the entire civil society sector. Distinguished guests, ladies and gentlemen, members of the media, good afternoon, Sanbonang. On behalf of the people of eThekwini Municipality, it is an honor and privilege to welcome all delegates to the 11th South African AIDS Conference. We want to thank the organizers of this conference for once again choosing the city of eThekwini as the host of this crucial gathering of all those who have committed themselves in the fight against HIV and AIDS. For us as a city, this demonstrates that indeed, Durban is open for business and continues to be on the path of the recovery as we welcome visitors after experiencing 3 devastating disasters in the last 2 years. This also confirms that our hard work of rebuilding the infrastructure that was severely damaged during the April 2022 floods is beginning to yield good results. Recently, we successfully hosted the International World Table Tennis Championship, the 48th Down Run Comrades Marathon, Africa's Travel Indaba, 5th Global Conference on the Elimination of Child Labor, and the 7th South African TB Conference. The hosting of these events, Honorable Minister, particularly after the catastrophic floods, demonstrate the resilience of the city and its people. We are working with all stakeholders to rebuild our city's infrastructure, and we are confident that the reconstruction efforts are well on track. And we have committed ourselves to build better and smarter. Ladies and gentlemen, we want to assure you that we have put all measures in place to ensure that eThekwini delivers a successful and impactful AIDS conference. during the 3 days that is scheduled. This conference takes place at a time when the city is intensifying its drive to end HIV and AIDS by 2030. This morning, we launched the groundbreaking You Equal to You campaign, which focuses on encouraging people who are HIV positive to take ARVs as prescribed so that they can suppress the virus and not transmit it to their partners and unborn babies. The launch of this campaign follows the scientific evidence that has been demonstrated over the years that if your HIV is undetectable, you will not transmit it to your sexual partner. Hence, the undetectable equal to untransmittable campaign that we have launched early this morning. We call upon the people of South Africa to rise up and join this campaign to end new HIV infections. It is important to note that as we gather here today, the rate of HIV and AIDS infection has increased to 8 million in the country, and the numbers are increasing daily. eThekwini is contributing to those numbers. Therefore, we all have a role to play in ending HIV, TB, and STIs. The ABC message of abstinence, be faithful, and condomize remains relevant. We must also encourage people to check their HIV status regularly so that they can stay negative or get care to remain healthy. We want to take this opportunity to convey our profound gratitude to all stakeholders who are working with us, especially here in the city, in the province, to curb the spread of TB and HIV. Through these collective efforts, we have been able to screen people for TB who displayed symptoms of an active TB infection and put them on treatment. Of approximately 600,000 people who are HIV positive in the municipality, over 465,000 are on antiretroviral treatment. Now we need to drive a robust campaign to encourage patients to remain on treatment. We acknowledge that with the high levels of poverty and unemployment, some people are unable to take their medication as required because they cannot afford to buy food. It is for this reason that as the city we have increased the number of our operational nutrition centers to 87, from 87, and funding has been set aside for additional 25 in the next financial year, which is starting on the 1st of July, Honorable Minister, where hot meals are served on daily basis. Each and every ward out of 111 wards of this municipality will be having this facility. We encourage, thank you. We encourage indigent communities, particularly those who are on chronic medication, to utilize these facilities. With these remarks, we want to welcome you all to our beautiful city of Durban, and we are confident that this conference will be a resounding success. Welcome to eThekwini. Feel our warmth, welcome, and hospitality as you walk around and in your own spaces where you'll be resting in your hotels. You'll see how people of KZN give you a warmth welcome and the love and laughter that is here in eThekwini. Always boast with our weather, sand, sun, and surfing in this city. You are all welcome to eThekwini. Thank you.
Thank you, Executive Mayor. Us Joburgers, we just love coming to eThekwini because as soon as we get here, we can take off our winter jackets and just enjoy the warmth of course eThekwini. Thank you.
Thank you, Gloria. And at this moment, we would like to ask us all to observe a moment of silence for our brothers and sisters, our friends, our loved ones who passed away from this epidemic, those who are affected by this epidemic. Can we observe a moment of silence? Thank you. Over to you.
We will then proceed with the opening address. The Honorable Minister of Health, Mr. Joe Phaahla, the chairperson of the SANAC Civil Society Forum, Ms. Steve Litsike, the chairperson of SANAC Private Sector Forum, Ms. Mpumi Zigalala, the Honorable Premier of KwaZulu-Natal, Ms. Nomusa Dube-Ncube, the Honorable MEC of Health, Ms. Nomagugu Simelani, the Honorable Mayor of eThekwini, Mr. Makolisi Kaunda, the Director General of Health, Dr. Sandile Buthelezi, the SANAC CEO, Dr. Thembisile Kulu, the UN Regional Coordinator, Mr. Nelson Mufu, the WHO Country Representative, Dr. Owen Kalua, developmental partners present, UNAIDS, WHO, US government agencies, the Dira Singwa Board, acknowledging the 9th SAA's chairperson, Prof. Resilium Paswana Mafuya, esteemed guests and conference delegates, members of the media. It is an honor and a privilege for my co-chair, Dr. Tato Chirarikire, and I to welcome you to the SAA's conference at the Durban International Convention Center. This year marks the 11th SAA's conference since the launch in 2003. A lot has happened since then, but despite that, the SAA's conference remains a prominent platform for knowledge sharing, collaboration, and advocacy in a fight against HIV/AIDS and TB in South Africa. Delegates, for more than 40 years, the world has lived with an epidemic that has wreaked havoc in our lives, targeting the most vulnerable, particularly in sub-Saharan Africa. Today, despite all the tools at our disposal, South Africa remains one of the highest burden countries affected by the epidemic, with an estimated 8 million people living with HIV. The COVID-19 pandemic has exposed our fragility in responding to the HIV and TB epidemic. As the pandemic gripped the world and South Africa, we lost focus on an epidemic that counts on distraction to continue unabated. During the COVID-19 pandemic, as the world looked away, young people continued to be infected by HIV. Although the HIV incidence rate in youth is lower in 2022 compared to 2019, the rate of decline will undermine South Africa's ability to reach the 2025 Global Prevention Coalition targets. During the pandemic, people living with HIV, including key and vulnerable populations, lost access to HIV testing, prevention, and treatment services. Health systems crumbled under pressure as healthcare workers, the backbone of HIV service delivery, succumbed to the pandemic. HIV supply chains got affected. The pandemic exposed and widened inequality in our society, a breeding ground for ongoing HIV and TB transmission. Inequality has been highlighted by the UNAIDS Global AIDS Strategy 2021 to 2026 as a significant barrier towards ending AIDS. Despite this, we as a nation have remained resilient because resilience is part of our DNA. We quickly used the lessons learned in HIV to respond to COVID-19, and we used the lessons from COVID-19 to get back on track. We leveraged innovative technologies and service delivery models to restore access to care. The question, however, is, are we prepared to protect the response from another pandemic, from another global health threat? Can we afford for the HIV response to be derailed again? I think not. Not when, according to the Global Alliance to End AIDS in Children by 2020 report, that a child dies from an AIDS-related death every 5 minutes around the world. That, distinguished guests, is simply unacceptable. We are here today to act now to make sure this does not happen, especially when we have tools to make sure children born of mothers living with HIV are born HIV-free. For how long are we going to accept the status quo? Kuzoba kube nini, delegates? Have our communities not suffered long enough? Kwanele, distinguished delegates, we need action now to end the AIDS epidemic. Our people are counting on us for answers. We are accountable to them. We are counting on this conference to address the following burning issues that are hindering progress. Stigma and discrimination. There is no place for stigma and discrimination in our modern society. We therefore condemn the passing of the Ugandan anti-LGBTQIA+ law in the strongest terms. It is inhumane and makes a mockery of the advances made in the fight against HIV. We also call for the speedy passing of the amended Sexual Offences and Related Matters Bill that decriminalized sex work. Sex is, after all, work. Access to long-acting HIV treatment. We applaud the approval of long-acting prevention intervention, the dapivirine ring, the cable, by SAPRA, and approval for the licensing of cheaper generic versions by pharmaceutical companies. That, delegate, is long overdue. We have guidelines for new and better pediatric drug formulations that have been developed. Can we ramp up implementation already? Children cannot wait. We also need to address barriers to access to prevention and treatment services. This includes load shedding, HIV research and supply chains and service delivery needs uninterrupted supply of electricity. HIV vaccines and cure. We need to keep pressing on despite the setbacks. We hope that the mRNA technologies will bring us closer to cure. Global shifts from HIV pandemic towards pandemic preparedness. Delegates, as the world deprioritizes HIV funding, it does that at its own peril. Pandemics and HIV have a mutual beneficial relationship. Funding to end the AIDS and HIV and TB epidemic is in everyone's best interest. Lastly, youth empowerment. We demand an AIDS-free generation, and that is non-negotiable. So, Tato, What can we look forward to in this conference?
Thank you very much, Gloria. I will now take us through to what is it that we're expecting in these 3.5 days. And once again, all protocol observed. As per the theme, the 11th SAA's conference provides an opportunity for us to act, to connect, and to end this epidemic that has been with us for 4 decades. This is an opportunity for all of us to bring together everyone living with HIV, the scientists, the researchers, government, NGOs, development and implementing partners, civil society organizations, policymakers, and the community in general to ensure that we network, we establish new collaborations and advocacy, and we put HIV back under the spotlight. So what does this mean? It simply means the time to act is now. We need to face this epidemic once and for all and put it to bed. The science is there, the know-how is there, so we need to ensure that everything that we need is utilized with agency to ensure that we win. We've put together a very exciting program that you all have in your bags, and it features plenary sessions, oral and poster presentations, workshops, symposia, and exhibitions. We have over 1,900 delegates attending, over 200 speakers participating in various sessions, and 223 poster presentations. As mentioned earlier, the objective of the conference really is mainly to bring all of us together, the HIV community, together under the same roof to review, to reflect, and to ensure that we look at the progress that we made towards HIV and AIDS and TB epidemic control in the midst of the pandemics and other global health threats. We also wish to provide a voice for the youth affected by HIV, as they take on a leadership role in tackling the epidemic. This comes at opportune time, this being June, the Youth Month, and just a few days after the Youth Day. I'll take us through the tracks that unpack these objectives. We have track 1, which is epidemiology and pandemics. Just in summary, this track will focus on the latest research, debates and dialogues, and strategic information, surveillance and projections on the epidemiology of HIV and related comorbidities, as well as our trajectory towards reaching the goal of epidemic control. Track 2 focuses on basic and clinical sciences, which really will be on issues related to the prevention, treatment, and eradication of HIV. My co-chair has talked a lot about what is expected in terms of prevention and treatment. The track also covers the advances in various aspects of host genetics, virology, immunology, microbiology, and systems biology that are relevant to understanding viral infection, pathogenesis, persistence, and synergies with agents and other biological pandemics. We also have behavioral science. We know that when we talk about combination in terms of prevention, we also need to talk about social and behavioral science. That's track 3. It seeks to recenter social behavioral science at the core of the HIV response. The track focuses also on AIDS-related research, on policy and interventions presented from a socio-behavioral perspective. We have track 4, which talks to implementation science, and it focuses on how the most effective HIV interventions and innovations reach the people that need them most, especially in resource-limited settings. And of course, we cannot leave the community. Track 5 focuses on community leadership and advocacy. We know that the UNAIDS Global AIDS Strategy and our 5th generation NSP, 2023 to 2028, articulate community leadership in the fight against HIV. This track emphasizes community advocacy, leadership, and monitoring. And then, of course, all HIV response needs finance. So track 6 talks to policy, finance, and ethics. It will focus on social, political, economic, and health systems in terms of policies that negatively or positively influence an individual's or community's response to the epidemic. And then lastly, we introduced this year a track on youth and HIV. This is a track that we really welcome that will focus on the critical role that young people play in their diversity in the HIV response by reflecting on their lived experiences and how that impacts their psyche and decision processes. The track seeks to unpack the persistent social and structural barriers that negatively impact on young people's access to services. Again, as per the saying, nothing without us, nothing for us without us. And this track ensures that young people are not just seen, but they are also heard. I thank you. So at this point, I would like to call Professor Kola Kamlisana to the stage. As I read your bio, Prof. Professor Kola Kamlisana is the Executive Manager, Academic Affairs, Research and Quality Assurance at the National Health Laboratory Services since July 2018. Prior to this, she was the HOD, Medical Microbiology at UKZN, IALCH, and also served a term as a member of the NHLS board. She has previously been an active HIV and AIDS researcher for over a decade, and focusing on HIV prevention and pathogenesis, working at the Center for AIDS Program and Research in South Africa, CAPRISA. Over to you, Prof. Thank you.
Thank you very much. Good evening, is it afternoon? Good afternoon, everybody. And I would really just like to take this opportunity to greet my Minister of Health, Minister Joe Pahla, all the dignitaries, the politicians, the MECs for health, and all the colleagues that are here. And really, it is more than an opportunity and an honor for me that I was asked to give this plenary. And I decided that I will make an announcement once and for all. Yes, I am four-legged. Yes, I fell, so that everybody knows, and I don't get the 1,000 people asking me what happened. Yes, I fell. I broke a few bones on my ankle, needed surgery, and I'm now 8 weeks post-surgery. As you can see, the POP is off. It's the moon boot now and the crutches. So I'm still struggling, walking on crutches and hoping this will be over soon, but I am recovering. Thank you. Thank you so much. I was asked by the committee, and I really see it as a great honor, to just take us back as to where we have come from. Just take stock. I mean, this was a great exercise for me, and it really brought in so many memories, you know, thinking way back where we come from insofar as the pandemic is concerned. And when I look at this, it's truly intertwined with who I am today, because when I reflect back and how, you know, my career has progressed, it really has been through the epidemic and everything else that has been happening through that. So I felt it was like me walking through my life and just reflecting to see where we are. And, you know, how much more important to reflect on the recent pandemic that we have come through. But as always, as the human race, specifically South Africans, somebody has already said we are a resilient nation, and we are able to overcome whatever comes our way. And I feel we are still on that same track. So if I just look, I thought what we will do is to just look at where we were before the pandemic, what had been achieved, and where did the pandemic take us through, and where are we as we speak today, and what then happens next, and how do we move from here? So just very briefly, I mean, as I'm saying, historically, I'm trying to see where to point, but I will see. So really, when we're looking, way back in the 1980s, we had the first HIV diagnosis in the country in 1982. I don't know what percentage was not born by then, that's in the house. And then we had the first AIDS death around 1985. And as we all know, in any other country, there was this downplaying. I think as South Africans, we probably felt, no, it's not going to happen to us. It's only a disease, that's occurring in the West, in particular, communities. It's not going to touch us. Little did we know. And when we moved in 1990, actually, I remember this because I was a registrar in microbiology around that time, when for the first time we did an antenatal survey, and we're looking at HIV, looking at antibodies then, and lo and behold, we had 0.8% of pregnant females being HIV positive. And we all had a shock. And really the rest is history. Because from that 0.8, which was done for the first time, we just kept on multiplying and multiplying to where we ended up. We saw the escalation in the 90s. We saw the establishment, and the impact, the effect of government trying to establish. For example, the SANAC, South African National AIDS Council, was established in the 90s, and actually, because we knew even then the impact that HIV was having on tuberculosis, and that's why we had to target TB as well. Came the 2000s, for the first time, actually, when I look back, the first strategic plan was signed off by Minister Manto Shabalala Msimang in January 2000. And we all know what we went through in the 2000s. It was a very dark area for most of us, especially those in research, when there was this struggle and there was this debate about the existence of the virus, about whether the virus causes AIDS or not. And we really lived through that phase, and it was very, very difficult times. And whilst these debates were ongoing, we continued to bury our families, to bury our relatives, to bury our friends. I remember in the mid-2000s, funerals were every day. And we really became used to people, young people, dying of AIDS whilst we were busy debating whether HIV caused AIDS or not. But fortunately, because we have got such a strong, such a strong voice as the communities of the country, civil society rose up to the occasion and they really put their foot down, and we began to see activist group advocating for treatment as earlier, as those years, because by the 2000s, we had seen the impact of antiretroviral therapy around mid-90s in the Western countries, where we immediately saw the impact that once you made antiretroviral drugs available, there was a definite decline and people were able to live longer. I'm looking for water. And then, within the 2000s, the second strategic plan was set up, which was, for the first time, National Strategic Plan for HIV, AIDS, STI for 2007 to 2011. I think this was the time when everything began to take shape, because by that time, we realized that we really had a huge problem in our hands. And in the 2010s, we then introduced tuberculosis because we realized these were two important syndemics and we couldn't really look at one excluding the other. And and this is the time when we then began to see, as we're integrating HIV and TB, then there were definite efforts to reduce stigma, because the stigma was a huge issue. And it really is quite shameful that even in 2023, we're still talking about stigma, because we have carried this message for such a long time. And the question that we need to ask ourselves, when are we really going to stop stigmatizing anybody, any condition for that matter, and realize that you are human at the end of the day, irrespective of what we are going through that particular time? And we then, towards the late 2010s, 2019, 2018, 17, the whole structure and how we manage HIV changed when the universal test and treat came in. And I mean, when I saw that picture, a lot of you might have been on that, those huge marches that were orchestrated by civil society, where people of South Africa were demanding for what was their right. And these are the various stages of the NSPs that we have had. And I will never forget this one, that, from originally, it had been called an HIV and STD. We're still calling STIs STDs that time. And came 2007, and then 2012, we integrated with TB. And I remember when I was with SANAC, and, at the first meeting of the trustees, my concern was that we have got this NSP, we call it HIV, AIDS, and Steve is laughing because she knows exactly what I said. It's called HIV, TB, and STIs. But if you were to look back at the previous plans, how many times are we mentioning sexually transmitted infections? And in fact, if you were to reflect back, you would find that until probably, around the 2017 one had a little bit more about STIs. And it was very clear to me that you cannot talk about HIV and not talk about STIs, because HIV is sexually transmitted for all practical purposes. I mean, the majority of people, that's how they get it. And so it doesn't matter that we always brush over STIs. And even with TB, it was great to see TB being integrated into the program, because we know that this is a syndemic. You cannot control HIV without controlling TB. So really, I am more than thrilled to see the recently launched a strategic plan that has dealt a lot more around all the three important diseases that we're talking about, and we need to move for that. So this also gives you a little bit of history, what we've gone through. But I mean, as you can see, earlier on, 1989, 91, up to 2007, what really had been happening, you can see the increase, the recent and rapid increase of HIV prevalence that we saw in incidents during those years. We started at 0.8% at antenatals, and by the end, we're actually sitting at almost 30%, more than 30% actually, in antenatal women, especially in KZN. And we really have lived through that. And lo and behold, TB as well was following, and we saw this rapid increase of TB cases as we're following the pandemic. So these are just numbers, and I don't want to dwell much on numbers because we know this, we've been through this, and even in the conference, we'll probably get a lot more about numbers as well. But just to see what happened over the years, how prevalence increased from 1.2 to about 19 for general population by 2017. And how the incidence peaked in the late 90s as we saw how many new infections we were getting. And the HIV-related deaths as well escalated, as I was saying, how we were really burying young people. Even with TB prevalence as well, we saw this, for instance, even as actually recently as in 2017, whilst we have made so much ground insofar as HIV is concerned, I feel personally we have lagged behind insofar as TB is concerned, and we need to ramp up and make sure that we actually have a positive impact that gets to be sustained. So it thrills me that there was a TB in Daba earlier today, because we really need to focus on this. And I will just highlight a few things, during my presentation. And in 2021, we still have got an unacceptable incidence of TB that's sitting at 513 cases per 100,000. And even though it is a 48 reduction from 2015, it still is way above what is expected. So we need to work and work much harder. We have seen the impact of HIV treatment, and everybody knows that. I remember there was a time when we were all fighting and motivating and trying to get antiretrovirals available to the public. And the minute, antiretrovirals were introduced, we began to see people living longer. And the stigma, I would imagine, did reduce to an extent because people could identify and they saw that if I were to start therapy, I actually am going to live longer. And we have seen the benefits thereof, where even the life expectancy actually increased from 54 to about 65 years. And we are hoping that it's still going to continue to rise. And we saw that starting antiretroviral therapy early, especially even with higher CD4 counts, it actually allows you a normal lifespan. Where now we are looking at HIV as any other chronic disease like the other NCDs, and we need to stick to that. And everybody needs to understand that once you know your status, then and you start therapy early, then you really are able to live longer. What about STIs? We have seen, if you look at these graphs, actually, there's hardly any impact that we have shown on management of STIs. This is looking at gonorrhea. Over the years, really absolutely no difference whatsoever. We have made absolutely no impact. We still continue to see STIs, whether it's gonorrhea. Even though with syphilis, I remember as a registrar, when we're looking at syphilis, there were times when the syphilis prevalence was sitting at about 11%, but with introduction of screening of pregnant women and treatment, we were able to reduce syphilis to quite low. But the problem is that we need to be vigilant, we need to make sure that we do screening, and we need to ensure that mothers that are positive, they get treated, because we really don't want to be seeing neonatal syphilis, not in this age, and we need to be quite vigilant about that. So, where did the pandemic take us? I'm sure everybody remembers these graphs, the whole country. We lived through this in the past 2.5, almost 3 years, where we're looking at the different waves with COVID-19, and it truly was a very difficult time, I'm sure, for everybody in the room. But what actually happened? This is a busy slide, I know, but I just want to focus really here, because what this slide is showing is just some of the impact on the various programs that we have managed to achieve as a country. And unfortunately, as somebody was saying earlier on, we tended to forget about what we had already, and we just focused on what we didn't know. And that's a huge mistake that we made, and we need to learn from that and make sure that we never do it again. So what happened is that health services really almost, were very put under a lot of strain, crumbling in some areas. There were disruptions. Some were limited, but others were actually quite significantly affected. We saw the health workforce, who we are, and we lost a lot of colleagues during this period. And this resulted in an increased absenteeism. We saw increased workload for those that were able to remain and remained well. We worked through a very difficult time. Fear and stigma was the day, a routine. People, when they left their homes to go to hospital, they didn't know if they were going to come back, or they might actually end up needing to be admitted in those hospitals. So we worked through very difficult times. Movement restriction, limited access to prevention and control programs affected the general South African walking in the street. I remember this one morning after the complete lockdown, after 2 weeks, and I was driving from work, and it looked like a ghost town, driving in Joburg, and there was not a single car on the road. It really was a very strange and eerie environment. But look where we are. And we are able to take from where we were, learn the lessons, and struggle on again. And what also happened, it was not just on the primary healthcare facilities, it was viral load testing, every other area. We saw an increase even in HIV-related deaths because people were not able to access their treatment, and we need to do something about that. And this sort of dramatizes this a little bit more, but even with testing now, as a lab person, the diagnostic testing of TB, we saw a decrease of more than 50%. If you're looking at this was around the complete lockdown, where there was a significant decrease in testing for TB, which means we were not able to pick up cases during that time, even though, fortunately, we have managed to get back to where we should be. Not just TB. Fortunately, as far as viral load testing, there wasn't a significant decline, even though the issue was around people accessing their treatment. But even with pap smear volumes, there was a significant decrease during the lockdown, and we actually have not managed to get back to where we should be. So there's a lot of work that still needs to be done. We saw the same thing with STIs as well. This was one study which really just looked at male urethritis syndrome. So during the lockdown, you can see the significant decline of people coming up for testing, even though we managed post-lockdown to get back. So you can see that during the pandemic, there was a definite drop in services, and this may probably be because of reduced service delivery, because of the interruptions, service utilization, because of movement restrictions, and also it's good to see that we have managed to get back, though not as much as we would like to. So I've already highlighted what now has happened. So where are we? We have recently had the launch, I think it was in March, of the new NSP. And as I say, it's not just TB and HIV, but there's a significant section around STIs, and not just STIs alone, but actually it's even added vaccines as well. And I think it is definitely the right direction, because this is how we need to move. Yes, this was the launch. As you can see, what I like about the current NSP is actually called the People's NSP. And SANAC, we are waiting to see, and I want to call on every South African that this has got to be an NSP that we all own, and we see what is it, in whatever area that I'm working in, how do I make sure that at the end of the day, we end the threats of HIV, TB, and STIs by 2030, because that's what we want to see happening. So, just a few highlights, and I'm not going to go much into this. If you're looking at what we really are wanting to focus on, integration is critical. Community engagement is critical. And we talk a lot about strengthening the health systems. We saw how the health systems almost crumbled under the strain and the stress that was put by the pandemic, which means as healthcare workers, we need to ensure that we build stronger systems that are going to sustain any challenge that we come across. I decided to put this on because we need to also identify what are some of the tools that we have as a country that we can tap into that will assist us even as we map the way forward as to what to do. Now, as a laboratory person, there is one great asset that we have as a country, in that we have the National Health Laboratory Service, which actually services all public health facilities in the country. And we have a single lab information system, which means it doesn't matter where the patient goes to. Whatever sample that gets taken, it gets recorded onto this system. So we have got this richness of data that's available for the country. And we need to therefore identify how do we turn that and ensure that we are able to then look at patterns and trends in the country, be it HIV, TB, be it non-communicable diseases for that matter, or any other disease that we want to look at as a country. We have got that wealth, and we need to tap into it and ensure that it then informs how we change policy, informs where the next step should be, because it's a resource that is available. So this is just one example where we're looking at the HIV cohorts, and we have actually created these cohorts, and what has actually happened is that we're able to use a unique patient identifier, which then allows, trends over years to see what is happening. We have had these rollouts of antiretroviral therapy. We have had these viral loads that get taken and CD4 counts, but what do they mean? And how do we translate that into seeing whether whatever programs and systems we put in place are effective, and how do we identify gaps and therefore make sure we strengthen those gaps? So this really, for me, is an important one. And just one highlight, what we have seen on some of these cohorts, where following 2.4 million people living with HIV and AIDS, were able, those that had viral loads that were below 200, and were able to note that 73% of those that were monitored 12 monthly, they had their viral loads controlled. The viral suppression was persistent, which therefore means even beyond 12 months, we've got data that shows that as long as people are on treatment and we are able to maintain viral suppression. Talking to what was said earlier on, viral load undetectable means untransmittable. So, where do we go from here? Starting with TB first, for me, I think one of the biggest, obviously, there are lots of other areas that need to be worked at, but I think for TB, I'm almost done. For TB is to really look at diagnosis. There's an article that somebody wrote which says, if we cannot find TB, we cannot treat TB. If we cannot treat TB, we therefore cannot end TB. So it all starts at finding cases. And for me, that's what we need to focus on. Whatever we can take, we need to find TB cases so we can treat them. STIs, diagnostics as well. We need to move away from syndromic management because you all know that it does not work. Syndromic management overtreats physiological illnesses, physiological discharges, and at the same time, we know that the majority of people with STIs are asymptomatic. So why would you look for syndromes? Why would you look for symptoms when we know that the majority is asymptomatic? And therefore, we need to identify cases who identify high-risk populations. Let's find the key populations and ensure that they are diagnosed. There are enough diagnostic, especially rapid tests for now, point-of-care testing that can be used for STIs. We need to find the populations, diagnose them, and treat them. We have got an issue around antimicrobial resistance, even with STIs now. We need to identify what then become the alternatives, and we truly need to treat STIs. Insofar as HIV is concerned, and I'm sure a lot is going to be done at this, is going to be shared at this conference, we're talking about treatment as prevention. Let's identify the best treatment for our people and ensure that they get it early and they are maintained and with their viral load suppressed. We're talking about the dapivirine ring. It's great that now it's available to every woman in the country. Long-acting, injectables, vaccines. We cannot stop actually trying to find vaccines. We have seen the impact of vaccines even with the pandemic. So there are no boundaries insofar as development of diagnostics is concerned. We've got a wide spectrum. Many of the systems we are using for diagnosis are now open, and it's not just a matter of finding one disease, but you can diagnose a lot more diseases. The acceptance of the specimens that we're taking, we're improving the specimen so that we move away from things like sputa for TB, and we are able to use urine and sometimes using saliva. So there's a lot that is going on. We need to tap into this. We need to ensure that no one is left behind. We need to get an understanding of social behavioral science. We can never understand these syndemics without understanding social behavioral science around them. We saw how collaboration and working together, both the private and the public sector, during the COVID pandemic, we need to maintain that and not drop it. We saw how if we are able to build resilient and sustainable health systems, the point for me here is that as we're building those, we need to maintain them. It doesn't help to build an excellent data system and then come end of the epidemic, we can't maintain it. We have seen how data actually allowed us to guide the epidemic as a country. And we need to therefore ensure that whatever systems that were built, let's learn from the pandemic and ensure that what was positive we maintain so that we're able to face all the other problems and challenges we have as a country. So, key actions for me, integrations. We're only serving one patient at a time. Whether they've got TB, they've got HIV, they've got an STI, they've got mental illness, they've got whatever, they've got an NCD. They need to come to one facility and be helped there. They don't have money to be driving around and getting, different times. They just don't have. And so we need to provide a one-stop for all patients. Secondly, we need to scale up testing. Whether it's HIV, STIs, it's TB, we need to find the cases so we know to treat them. We cannot do this without the communities. We have seen that. We need to enhance the surveillance, and whatever we have established during the pandemic, let's optimize and ensure that there's funding for vaccine development in the country. There's funding for sustaining the genomic sequencing that has happened, and we saw how we flourished as a country, as scientists of South Africa, because of what we were able to put together. So really, let me just thank everybody who helped me to put these slides together, and I want to wish you a great conference where we can learn something, and everybody comes out here saying, I want to make a positive contribution in ending HIV, TB, and STIs come 2030. Thank you very much.
Thank you very much, Prof. Mlisana, for that insightful presentation. So at this point, as the chairs of the conference, we would like to acknowledge that the conference includes everyone, including people with disabilities. And then for that, we would like to apologize for the oversight in terms of not having the sign language. And we would have that as of tomorrow. We do apologize. I would like to then call Mr. Nelson Mufu, who is the resident coordinator of the United Nations in South Africa. As you approach, Mr. Mufu is the resident coordinator, as I've said, and assumed office on the 12th of December, 2022. Still fairly young. Come through, sir. Following his appointment by the UN Secretary General, Antonio Guterres. Over to you.
Thank you so much, Program Director. And actually, following from the tour de force presentation that we just had, I think I would find ways of trying to shorten my remarks. But really, it's a pleasure on behalf of the UN family to be joining you here this afternoon at the opening of this auspicious conference. Honorable Minister, Honorable Deputy Ministers and MECs present, Your Worship, the Mayor, who I got to meet this morning, it's a pleasure to be here with you, as well as with your Deputy and all the other councillors present. Colleagues from SANAC, as well as the excellent professor at NHLS, who we just heard from. I stand on existing protocol, and I thank you once more. It is an honor to be able to be here and deliver a message on behalf of the United Nations system in South Africa at the opening of the 11th South Africa AIDS Conference. As the professor indicated, she would like everyone to come up here and indicate their positive contribution they would like to make in this effort. And as the UN, we look forward to continue working with partners, especially with the government, in ensuring that we stand in solidarity with the 8 million people in the country living with HIV/AIDS. This morning, with the Mayor, we witnessed the launch of the U equals U campaign, and this is really important because when it is undetectable, it is untransmittable, and we just heard that as well powerfully, and we support that. South Africa is a country that really you see collaboration starting from the highest level of government, along with the engagement of robust civil society, the contribution and support of international partners, and vibrant community members who are working collectively and boldly, bringing together cutting-edge science, delivering services that meet people at their points of need, protecting human rights, and sustaining adequate financing, and this must be celebrated. As a result, we're seeing steep declines in new HIV infections and AIDS-related deaths. Recently, my boss, the UN Secretary General, Antonio Guterres, on World AIDS Day in 2022, indicated that the world has promised to end AIDS by 2030, but we're off track, way off track. And he affirmed that to end AIDS, we must end the inequalities that are blocking progress. And we see these inequalities reflected in this beloved country as well. The curves are simply not bending fast enough to stop the pandemic. Last year, approximately 200,000 South Africans became newly infected and 51,000 died from AIDS-related illnesses. Infections and deaths are indeed following the fault lines, as I indicated, of inequality. Women and girls, unfortunately, and not unsurprisingly, account for the majority of new infections in South Africa. Adolescent girls and young women aged 15 to 24 years of age are 4 times more likely to be infected with HIV than boys and men of the same age. We must deepen our push and fight to eliminate the disproportionate vulnerability of girls to HIV. That is why through initiatives such as Education Plus to keep girls in school, the Generation Unlimited initiative, and of course the Eastern and Southern African Ministerial Commitment, we all hope collectively that we can help adolescent girls to be empowered with the knowledge they need and the socioeconomic opportunities to avoid decisions about their bodies and pathways that hold them back, such as risk of HIV infection, risk of unintended and early pregnancy. We must work to also counter the high levels of gender-based violence and to ensure that intimate partner violence is also curbed and that everyone living with HIV has access to life-saving services. It is also important we do not forget children, and closing the gap for treatment for children will save their lives as well. That is why the UN in South Africa stands ready to rally behind the Global Alliance to End AIDS in Children by 2030. We are also committed, like I indicated, and very happily joined the launch of the U=U treatment literacy campaign. The struggle for equal access to health technologies, as we also heard recently, is one that the HIV movement has led valiantly. This struggle for the best HIV tools that science can offer to all people who need them is something that we need to keep on supporting in South Africa. And breakthrough science alone, as we also know, is not enough to end AIDS. That is why we welcome the fact that in South Africa's new National Strategic Plan for HIV, TB, and STIs, shifting the environment of laws and policies that stand in the way of the impact of science is something that is central. In this regard, we also, and I was happy to see the celebration in the hall earlier, the need to step up efforts to remove punitive laws against key populations, which is fueling HIV. We have witnessed firsthand in this country that decriminalization and addressing stigma faced by vulnerable and at-risk populations has led to greater access to HIV treatment for more than 5.7 million people. The United Nations, therefore, welcomes, Minister and colleagues, the South African government's decision to review its laws relating to sex work among consenting adults, thereby moving us closer to reaching our collective goal of ending the AIDS pandemic or epidemic by 2030. To end this epidemic, community responses are also to be scaled up. Our health workers, not just in hospitals or clinics, but also in communities, are central to fighting this pandemic and need to be supported. And this leads me to my final point, the importance of sustained and adequate financing for investments in health infrastructure and systems, including essential workers, and for social protection and education. On the African continent, South Africa is among the top-ranking countries in allocation of revenues to health and must be applauded for financing 69% of your health response. The UN therefore looks forward to working with you to implement the recently approved National Health Insurance Bill to address healthcare financing challenges and provide universal access to quality healthcare for all South Africans, irrespective of their socioeconomic status. The UN in South Africa and its joint program on HIV and AIDS will continue to work with our partners in government and civil society organizations to generate and promote effective use of strategic information, scale up rights-based HIV services for all, ensure equitable financing for the HIV response and broader health systems, and of course, strengthen the capacities of communities and their meaningful engagement in health, social protection, and human rights. Honorable Minister, distinguished guests, friends, and colleagues, allow me to end by once more expressing our solidarity with the government and the people of South Africa to continue to act, connect, and end the pandemic. I wish you fruitful deliberations over the coming days, and we look forward to the outcomes of this auspicious conference. Thank you again, and good evening.
Thank you, Mr. Nelson Mufu. Delegates, in the interest of time, we're going to just accelerate the program. I wish at this point to also acknowledge the Gauteng MEC, Ms. Nomantu Nkomo Ralehoko, Honorable Deputy Minister Henrietta Bohopani Zulu, and also Deputy Minister Honorable Dr. Regina Mahaulet. So without wasting too much time, we're going to move on to the next speaker. And again, in the interest of time, I will not go through the entire bio. It is in the pack for you to see. The next speaker, this is a pre-recorded video from Anjali Ashreka, Dr. Anjali Ashreka from UNAIDS. She is the UNAIDS Deputy Executive Director of the Program Branch and an Assistant Secretary General of the United Nations. Prior to joining UNAIDS in January 2023, Dr. Ashreka served as a Principal Deputy US Global AIDS Coordinator of PEPFAR. So without wasting too much time, please can we play her video?
Your Excellency, Deputy President of South Africa and Chairperson of SANEC, Honorable Mashatile, Honorable Minister of Health, Dr. Fala, Honorable Deputy Ministers and MECs present, Honorable Premier of KwaZulu-Natal Province, Your Worship and our host, Mayor of eThekwini, SANEC Co-Chair and Civil Society Forum Chairperson, South African National AIDS Council CEO, Conference Chair and Co-Chair, distinguished guests, colleagues, and dear friends. South Africa holds a very special place in my heart, and it's an incredible honor to be with you today in the opening plenary of this conference on behalf of UNAIDS to share thoughts on South Africa's leadership in the global HIV response. Here you'll see on this slide what I hope to cover in this presentation: the global and local commitments, global, regional, and local epidemiologic trends, South Africa's contribution to the HIV response, and key actions to end AIDS by 2030. On this next slide, the fantastic news is that global and national strategic commitments are all aligned. And together, we must use these commitments to drive action at the country and community levels. Let me congratulate South Africa on the recent launch of its new National Strategic Plan for HIV, TB, and STIs for 2023 to 2028. There is strong alignment between this National Strategic Plan and the global commitments in the Global AIDS Strategy of 2021 to 2026 and the Global Fund Strategy, as well as PEPFAR's 5x3 strategy. On the next slide, the Global AIDS Strategy features bold targets and evidence-based actions for 2025 to ensure every country and every community are on track to the Sustainable Development Goal 3.3 to end AIDS as a public health threat by 2030. And we must move collectively with metrics and measurement against these metrics in place so that we can move urgently forward together. Here on this next slide, we're looking at epidemiologic trends, and we see global trends in new HIV infections over the past 30 years. We see a significant decrease by 54% since the peak in 1996. While then, at the peak in 1996, there were 3.2 million people newly infected with HIV. In 2021, we still have around 1.5 million people newly infected with HIV. And this is unacceptable. We must be aggressive and move with urgency if we're going to meet the 2025 target, which we are off track. Here we look at regional and national trends in new infections. East and Southern Africa is one of the 5 regions where a decline in new infections has been observed. When we look on the left with East and Southern Africa minus South Africa, we see a 41% reduction in new HIV infections between 2010 and 2021, and a 50% reduction in new HIV infections in South Africa between 2010 and 2021. Here's another visual to see this more clearly. In looking at the change in new infections country by country in East and Southern Africa, we see decreases for most countries in the region between 2010 and 2021. And when we look at South Africa, we see 50% reduction in new HIV infections between the same period. When we disaggregate further and look at females and males, we see a stark difference. And here we look at the estimated number of new infections per week when comparing 15 to 24-year-old females and males in 2020 by country. Adolescent girls and young women of the same age period, 15 to 24 years, account for 30% of new HIV infections among adults in East and Southern Africa regions. 3,400 new infections weekly, which is more than triple that of young men. The majority of new infections are occurring in South Africa, and this is 7 young women every hour. Again, we must target our interventions to address the populations most at need. Here in this slide, we look subnationally and also subpopulations. Again, the need to tailor interventions. Here we see, for example, that the distribution of new HIV infections by key populations in South Africa is estimated at about 12.8% of new infections in South Africa among key populations and their partners. And you can see the variation among subpopulations of key populations. It's important to note that key populations are actually higher than this figure, as this model does not include data on people who inject drugs or transgender people. On this slide here, we are looking at trends in AIDS-related deaths, and we see a reduction by 68% since the peak in 2004, and by 52% since 2010. Here, we are within reach of the 2025 targets for reducing AIDS-related deaths. And on this slide, when we look at decreases in deaths by region, we see an interesting graph. The greatest progress overall in reducing deaths happened in sub-Saharan Africa. And South Africa was the country with the largest decrease of 62% in AIDS-related deaths between 2010 and 2021, a real testament of the leadership and the progress in South Africa. But again, always important to look at subpopulations and disaggregated data. Here we see HIV testing and treatment cascade comparing children 0 to 14 years old in blue compared to adults aged 15 and older in orange in Eastern and Southern Africa in 2021. And this really highlights the disparities among adults and children. So we're moving to what will it take? 6 key actions to end AIDS by 2030. For example, here we're looking at falling and failing children when it comes to HIV and AIDS. We want to underscore the criticality of political commitment and leadership in ending the AIDS response. When we look at children, just as we were exploring the disparities before, we see that globally, a child dies from AIDS-related deaths every 5 minutes. In 2021, an estimated 800,000 children living with HIV were still not receiving HIV treatment. But new tools and new commitments provide an opportunity to deliver on the promise to end AIDS in children. According to the National Department of Health in South Africa, as of March 2030, South Africa is at 81, 61, 67 in terms of the performance against the 95, 95, 95 UN AIDS targets for children. Recognizing this inequity and the importance of closing the treatment gap for children to save lives, under the leadership of the Minister of Health, South Africa joined the Global Alliance to End AIDS in Children by 2030, a clear demonstration of the political leadership and commitment to end HIV-related inequalities. Here, we know we need to move urgently and push for HIV prevention to address the new HIV infections and really decrease the incidence. Again, political and financial prioritization of HIV prevention must be bold. We must shift from fragmented projects to large-scale implementation. It's been more than a decade since the first evidence of the efficacy of daily oral PrEP. However, there continue to be subnational gaps in availability of PrEP. The total number of people using this prevention option in 2020 was just under 30% of the target of 3 million in low and middle income countries, which represents only 8% of the new global target. Much of the PrEP scale-up is still highly occurring in concentrated countries, and we must move quickly to scale up PrEP. On the next slide, here, we must ensure that we realize human rights and gender equality. Discriminatory laws and policies are undermining the AIDS response by pushing people further away from HIV and health services and undermining public health efforts to reach those most at risk. UNAIDS welcomes and supports the decision of the government of South Africa and the Department of Justice to review their laws relating to sex work and supports the proposed bill by Cabinet to decriminalize sex work, including both the sale and purchase of sex. We must continue to support and resource community-led responses. The activism, mobilization, and on-the-ground work of community-led organizations have defined the HIV response and saved countless lives. Successful community-led monitoring, for example, has made valuable contributions to achieving equitable access to HIV and health services. And the Rachitse project in South Africa has been critical to this in terms of finding and successfully advocating for changes, as well as supporting high-quality services at the clinics. To end AIDS, we must address the prevention and care and treatment gaps in children, adolescents, and young people in key population groups, as we see in terms of inequalities that are expressed across the map. There are often substantial differences in HIV treatment access between districts in the same country, suggesting that people living in some parts of the country are not benefiting equally. And finally, we must ensure sufficient and sustainable financing as we look to sustain from a local level the HIV response into the future. Funding available for HIV responses in low and middle income countries has continued to slowly decline despite renewed commitments made by the UN member states in the 2021 political declaration on ending AIDS. Domestic investments have helped power the HIV response, but only a minority of countries with a high HIV burden are able to fully finance their HIV programs from domestic coffers. we really want to commend South Africa for their leadership and contribution to their own response using their domestic resources. It'll take all of us working together in close coordination and collaboration with the governments, with community, with PEPFAR, with Global Fund, to ensure we work together to sustain the HIV response, politically, programmatically, and financially. And we as UNAIDS stand with you in partners as we approach the 2030 goals, achieve those goals, but also sustain the gains and the HIV response well beyond into the future. Thank you very much.
Yeah, thank you very much. So just to further acknowledge some of the distinguished guests who are here, I'd like to acknowledge the MEC from Mpumalanga, Ms. Sasakani Manzini, the MEC from Northwest, Mr. Madoda Sambata, and the MEC from the Western Cape, Ms. Noma French Mbombo. So thank you very much. I think the UNAIDS delegates who are in this room will convey our messages of gratitude to Dr. Anjali Ashraka for a very important message. So without wasting too much time, I'm going to move to the next, also pre-recorded video from the SADC Regional HIV Representative, Dr. Lamboli Kumbuneki, and he will be talking about the regional African HIV response and how we can learn from each other. Let's play the video, please.
Ladies and gentlemen, colleagues and passionate of the fight against HIV, first and foremost, let me apologize since I could not be there in person with you to discuss and brainstorm about the HIV pandemic in our region. The 11th South African AIDS Conference comes again at the right time to remind us our commitment to end AIDS by 2030. As we are all aware, the clock continues ticking, and in less than 7 years, we are to fulfill the promise that we've made to ourselves, our kids, but also to the future generation, the promise for an HIV-free generation. The SADC region, despite only representing 5% of the global population, accounts for 44% of people living with HIV. And despite the economic, social, and political challenges that we face as a region, the head of state and governments have manifested a strong will in the fight against HIV. 20 years after the Maseru Declaration, new HIV infections and AIDS-related death has been halved. And in some member states, we have seen a tremendous achievement, very important progress, where we have achieved also the 95 targets, such as in Botswana and Eswatini. And we also know that furthermore are on the brink to achieve this historic milestone. Despite all this progress, adolescent girls and young women, adolescent boys and young men are still bearing the brunt of the epidemics. Key and vulnerable populations are still facing strong challenges in accessing HIV services. Let's use the opportunity that is provided to us by this AIDS conference to connect, learn, act to effectively end HIV. This is an opportunity for all of us to pause, brainstorm, think about the future of the fight against HIV. Let's galvanize ourselves, let's motivate ourselves, but also let's mobilize and sensitize the political leadership to mobilize enough funding to ensure sustainability of the HIV response within the region, so as not only to achieve the 2030 targets, but to ensure also that our HIV response sustained beyond 2030. As I come to a close to my small message to all of you, I wish you fruitful deliberation, and I hope that you enjoy the nice weather in Durban. Thank you.
We thank Dr. Lamboli in his absence and for the effort. He did apologize that the network was bad, that's why we didn't have a visual. But we thank him nonetheless. The next speaker is our young, vibrant Miss Regina Mary Ndlovu. Regina is a multi-talented professional with years of experience in the entertainment industry. Over to you, ma'am.
Thank you. Good evening, everybody. So I got the privilege of getting this mic put on me because I want everybody to just have a great look at me before I start talking, right? So just have that look at me. Thank you very much. It's an honor and a privilege for me to be standing here. How I got here, I don't know, but I just give glory to God. So as I stand here, I want whoever is listening to the sound of my voice to know that it is not how your story starts that matters, but it's how you decide to end it. You are the steering of your own movie. You are the steering wheel of your own car, and you need to make the decision to say, I am now in the driver's seat. As you look at me right now, I shouldn't be alive. Last year, 2022, I died. But as I stand here today looking like this, I am a miracle. So, born with albinism, as gorgeous as I look, the best of both, I am a half Zambian woman and a half South African woman. When I was born, the first person that told my mom, oh my God, what's going on, is the nurse. She asked my mom, is your husband a white man? My mom said, no, why are you asking? Then she just said, look at this. Just look at this. I was told that my father left for 2 weeks because he did not believe I was his daughter. But when he came back, because my great-great-grandmother, there is an uncle that I had that had albinism. So they explained to say, it's a genetical thing, and from there I had the best father in the world. But now, as you know, society doesn't come with a manual. When I was born, besides the nurse having those questions about me, the entire world has got questions about me. So people refer to me as an albino, a person with albinism, the correct words. There's beliefs in Africa that a person like me can cure HIV and AIDS. We're a curse, we're a lucky charm. The list goes on. How do I know these things? I didn't just get to find out that I'm going through these things. I walked through the path. At the age of 8, I was raped by a family member who I called my uncle. In total, I was raped 15 times from the age of 8 until I was 23 years old. I was locked up in the toilet because my teacher would not teach a child that looks like me. So I never learned how to read or how to write. And I'm short-sighted. I can't see far, but I've got the most gorgeous eyes ever. Everything that I knew was life experience. Every time I talk to parents, I always say, it is your duty as parents to teach your siblings how to handle each other. My mom and my dad did not teach my brother that I was his sister, I'm beautiful, and he must protect me. So when the community, the kids would laugh, they would scream, they would throw stones at me. That's exactly what my brother did to me as well. At school, I could not participate. In fact, I went to a private school in a way that some of us think as long as you are paying top dollar, the teacher would do everything. No, it is our responsibility as parents to be part of your child's educational progress through and through. One of the rapists was also my teacher. So life happened to me where now, because of the discrimination, the hate, the abuse, I began to hate myself. I attempted 11 suicides. I was locked up in Chris Hani Baragwana Mental Institution at the age of 17. I wanted to fit in. I couldn't read. I couldn't see. I was not accepted by any other human being. So I became angry. I became the devil herself. Why can you read? Why can you do this? Why can't I do that? So I would steal your book with the blue cover on it. I would go home, remove that cover, and that would be my work. I would let teachers come to the classroom and tell us, memorandum has come out. This is what you do. I would have to jump the school fence to steal the memorandum and the answer sheet just so I could fit in. Throughout my entire life, there was no hope. There was no direction. I didn't know if I would ever belong. In fact, I hated God with a passion. I was told God created you, but you're a curse, you are a demon, you are this. There was one point I got so mad and I took the Bible and I said, you God, you so-called God, how am I supposed to know you when this book has got the smallest words in the world? I tore the Bible up and I said, how am I going to know you? 2 days later, my cousin came and said, here is a CD, I want you to have this. When I took that CD, it was an audio Bible. And from there, I asked myself, are you telling me that everything that is written, I can be able to listen? And I started listening to this audio Bible to speak against this God. And as I listened, I came across a man called Moses, who was a stammerer, who felt useless about himself, who felt like he was not good enough to the world. But the so-called God says, even with your nothing, I can make you something. From there, I asked myself, this motivational speaker, this actress, this woman that I want to be, how does she speak? How does she walk? When I get into the room, am I coming like, hi, how are you? My name is, hello, my name is Regina Mary, and I'm here. And when I put myself together with all my challenges, with all my pain, with all my self-hate, I refuse to stay down. Today, as we speak, I am an actress, a motivational speaker. I'm on your Mzansi channels, Impika Tandazile Ibala, and I'm standing here in front of all of you, speaking to say it's not how your story starts, but it's how your story ends. I am the protagonist to a documentary called I Mary Documentary that is internationally going in every different country. As I stand here today, I'm also going to be the new voice for the youth, for the adults, for every person in this room that needs to take care of their body. Because as great as my voice sounds, it is nothing without the host and the body. People believe that people with albinism can cure HIV and AIDS. Guess what? I'm HIV positive and I'm living a positive life. I did not cure anything. But instead, I decided to say, you will not take away my life. And when you are positive, first thing that happens is that you don't know these things. You don't know you've got the virus. You don't know you're sick. So bit by bit, you start getting sick. Bit by bit, you have shingles all over your body. And if you do not have a background, a mom or a friend or a voice like myself that says, take your pills, girl, we can do this together, it's fine. You are going to be left in a space where you feel you are alone. So for 7 years, I did not take my medication. I didn't take it, and I thought I was going to be okay. Last year, 2022, June, I died. I was in Chris Hani Baragwana Hospital for 1 month unconscious. I had drips in my nose. I had a pipe in my private parts. I was wearing diapers. I was thin. What you see is a miracle and a blessing because I took power of my life. When people tell you you are going to die, it feels like it's just death. But they don't tell you the process of saying, bit by bit, your fingers get pulled out, your hair goes out, you start dying so slowly that the death is not a one-way ticket. You get to wear diapers. You get to have tubes. You get to be fed with tubes. Everything that I thought I could do was impossible. All I ever asked for was, what can I do? Can I have a second chance to make my life a better place? And the question was, how can you go back when you don't have a body? Because you're not taking your pills. So ever since July last year, it's been 11 months, I've been taking my pills and I've not missed a thing, and here I am. And also, when we start taking our pills, there's information we really don't know, because it's not popping up on our television every day to say, hi guys, it's 8 o'clock, you know what time is it? Nobody is doing that. Nobody told me that, listen, you can take your pills, but if you miss even that 2 days or 3 days, those criminals are going to creep out. Because what the virus is prisoners, and we have to keep them locked up. Just this year alone, February, I had 2 skin cancer operations. Because as a woman with albinism, the sun is our biggest enemy. In March, I was robbed of my phone and my laptop. In April, I was homeless, trying to put my life together. And in that process, I left home where I stayed so I could not get access to my ARVs. I was in Limpopo and I went to the local clinic to say, can you please help me with my ARVs? They said, no, which ones do you take? Then I didn't know that there's actually a list of them. Then I was like, can't you just give me? And they said, no, we cannot do that. And when I told them the types of medication I took, they could not have those particular medications in that clinic. And I wondered, then how does life go on if there's information that is so important to us and we are not out here standing boldly to say, this pill is not just a medicine. This has to be your friend. This has to be something that you realize that your body needs to stay here. If you're going to charge your phone 24 hours, you're even going to have power banks just so that you can be online, then your body becomes that tool that says you have to protect it. Because I went for 1 month without taking my ARVs, guess what happened? I had a chemical imbalance in my head, something I didn't even know. As we speak, I was discharged from Chris Hani Baragwana psychiatric ward in the last 28 days. And I said, but why? They said, no, you had a chemical imbalance, you didn't take medication, so therefore I was angry, I had a fight with my mom about something. And you know, sometimes in life, a person could be wrong and you are right. But because you are the loudest, you look like the crazy one. So I am coming from Chris Hani Baragwana psychiatric ward, where I met other women who are going through mental problems. As we sit in this room, there's so much of us that's got something underneath our layer. It doesn't matter if it's bipolar 1, if it's a chronic disease, if it's this. Take your pills. Stay alive. You need your body to do things. With everything I've been through, I told myself I want to be reference and evidence to other people with albinism. I want to be the voice. So throughout my life, besides having to reach this point where I am today, where I am saying top-level domain, TLD, which is the ARVs that I'm taking, I just wanted you guys to go through the second slide, please. So I'm a double portion. As you see, white, born from black. I'm also a product of half Zambian woman and half South African woman. Next slide, please. So with the advocacy that I've been able to do, and as I stand here, I still can't read, I still can't write. When you send me a message, there's an app that I press on, it reads out to me. If I need to text anybody in this room, I will take my phone and I will speak and my phone will send you a message. But even with all those challenges, it did not stop me from being the first woman with albinism to implement albinism in the life orientation question paper in South Africa. Next slide, please. This is evidence of saying it's not how your story starts, but it's how you decide to end it. When I Googled albinism, they said a curse, a ghost, an outcast. Today, I have changed that reference. When you Google albinism, you will find Regina Mary and the youth who have reference to say, it's not how your story starts, but it's how your story ends. Please, next slide. I am the talk show host and founder of an online talk show, My Voice Albinism, The New Era, where we educate, empower, and let everybody know that as I stand here, I need to apply sunscreen every 2 hours. I need to go for skin cancer screening every month, no matter the cost, because global warming and climate change is becoming a huge problem to all persons with albinism. Next slide, please. This is the achievement of not giving up on yourself, no matter the beginning or the foundation, whether there's no family, there's nobody. I'm an international award winner. I Mary documentary where I portray the protagonist. Next slide, please. Even with my challenges of not being able to read and write, I was part of Media 24 journalism, and this was the first article I wrote, Dynamic Models Speak Out. Thank you. Next slide. Gender-based violence. I was raped 15 times. Part of those rapes were not just outsiders, they were insiders, it was neighbors, situations that you would not think. As you think your daughter is next door playing with the other kids, there's situations that could be taking place, which is more I would like to talk about for all those who want to stand against gender-based violence and rapes for young kids. So I'm also a voice, not just for women with albinism, but for every one of you in here that cannot speak for themselves. Next slide, please. Skin cancer operation that I had. This is basal cell skin cancer carcinoma. As a woman with albinism, any minute the sun touches my skin, I am in a risk to have skin cancer. So I had a piece of my ear that was cut off and part of my chest. And other cases that have come to me through my voice that I've been able to help in terms of my advocacy. Next slide, please. And this is me and my brand, Regina Mary, my voice, and now officially your voice, because that's what we need. Once you become quiet, once you become silent, there's a septicness that happens to you as a person. It's almost like you are rotting inside your own body. And once something becomes rotten, it smells and it's bad to people. So a lot of us are sitting with problems of the past, with problems of saying, I cannot talk about this, I cannot do this. But what I'm saying is that do not let the worms go all the way until they turn you into the worst enemy that you could ever be. And now my final slide. Yes, have a look at that one. So, on my final slide, this is me, top-level domain. These are the ARVs that I take, and I want everyone in this room to know, take your pills. If you don't have a voice, I can be that voice for you. Thank you.
Regina, Regina, Regina. Thank you so much, Regina. Isn't she amazing? Thank you for sharing your life and sharing your challenges and your successes with us. At this point, I would like to call on stage just a little entertainment, our very own Fly Motion, just for a few minutes of entertainment. Fly Motion is our comedian.
One, two. Hello! DJ Oitane, hello, hello, hi! Agnes, I said hello, everybody! What's up? Hello. people. Hey, Mr. Mayor, how you doing? Thank you so much, DJ. Hello, everybody. Yes, my name is Fly Machine. I'm from here, KwaZulu Natal. I'm proudly Zulu. Any Zulus in the house? Hey, but man, I come with this song. I just want to say something. Please, for all the white people in the house, please just try and dance, man. White people can't dance. You can go to every party, you find them at what's going on. Hey. Please just learn, guys, rhythm. You are in Africa. We dance. Eh? Can you do the voice, man? Eh? Come on, teacher, let me show the memo voice. Man, the photo is like this. I'm a young beast, I'm a cow. 1, 2, 3. Thank you, sir. For white people, that is a gym. Hey, I can't be exercising all the time. Yeah, you must learn, please. White people, they don't want to dance. Please, just dance. Hey, yeah. You go to a rally, you go to a party, you are shocked. This is something like a chakam, I don't know. At least our Indian people, they can do something better. It's only the neck. And that's it. No movement whatsoever, only the neck. Hey, but you must use every port. Yeah. Shout out to Mr. Mayor. Hey, Mayor, how you doing? I saw you swimming the other day. This guy, he's asking for help. Help! I'm like, Mr. Mayor, I don't even have a boat. Yeah, man, but please, guys, where's the colored people? You guys, we don't know what you're doing. We really can't see you anywhere. Colored people, we can't see them. They're not at work, they're not at... Where are you guys? Colored people, I know you are here, but where are you? We don't see you. The only thing that colored people can do is carpentry. Yo! They can fix the cupboards, nah? Only the cupboards for the shop. Shop fitting is a thing. Yeah. And my Zulu people, where you at? Hey! Hey, Shayu for shop tanam. Yeah. Hey, about sister can dance. Shout out to the... Have you everybody seen the new Zulu series? Shaga Ilembe. Woo! Everything is out there. Eh? I know we see, yeah? Hey, small and big, but they're all out there. Hey, I was like, Aibo. But that is how we were before everything came up, before the sectors and stuff. Everybody, can you imagine in this room, everybody was going to be like, da-dang. The world people went, no, we can't come to the conference because you guys like, no, ma'am, come in with all, da-dang. And Namzambobate shook the whole internet. Eh? Hey, Mr. Mayor, you saw there. Eh? Yeah. Everybody saw what's happening. But I'm glad to be here and be part of this. And it's my first time coming to so many people who are embracing one thing, love. We're all here for love. You can clap, but clap, come on. Yeah. But I remember one thing. When I grew up, like, you know, when you grew up in the township, it's just a small story. Please just bear with me. But it's very important for everybody. I think maybe it's going to be for everyone. Like, you remember when you grew up in a township, right? And there will be only one Chinese guy that's going to come and take money from the whole community, go somewhere, come with a little bit money. And Mamru, people like, oh, I won. And somebody, oh my God, hey. And then there'll be few white people in the township. Like maybe just one. We had one in our era his name was Utreya. he used to fix things, like he was some sort of like a civil engineering, stuff like that. So I was like, oh my God, you know, when I grow up, I want to be a white man. Like, it's a dream for every black child, like for every black person. Like, when you grow up, you think you're gonna maybe evolve and be white. So going to school, I was thinking maybe I'm learning to be white. Only to find out that I can't change. I'm still black. And I'll be black till I die. That education failed us. I really, because I was thinking, you know what, when I reach matric, that's when I'm going to be like, hey, my man, hey, I'm no longer Makanya now, eh? I'm Fairwood. It didn't happen. I'm still here stuck in the township with drugs and prostitutes and everybody. Yo, black people can cheat. Now we cheat, eh? Yeah, I know you're not going to laugh at this joke now. Well, wait, you black people cheat. You white people, and this is where you're nice. You white people don't cheat. It's like, hey, cuz, it was just a fling, man. No more about it. Hey, you must date a black woman. That's where you see. Good cheating is a cheating. We cheat by force. We cheat by guilt. We cheat by everything with God. I cheat. Indians, no, what you do with that girl now? What you wear? It's okay. That's Indians. For black people, we cheat. Like, hey, yabona mangasengena uJola 99 la, wep. Ay, uyaphuthuma. Black people cheat like you don't care. The only thing I hate about cheating is those diseases and, you know, being like, you can't rest. If you cheat, you start like, hey, hey. You always like, hey. Yeah. It's just that I don't know what to say in English, but you know. It's one of those words, you know what I mean? Like, but you know, man, when you're like, hey, hey, something. Yeah, hey, hey, my wife. That's what I hate about cheating. You always, toes, and then the ring, and then the phone starts ringing, and then the wife says, hey, answer the phone. And they're like, hey, it's just a mayor, hey. Said, answer the phone, hey. You know, I hate those type of situations where you can't be yourself because you are cheating. And the more you cheat, that's when you having more, like, anything that you're going to have, like diseases, everything. And in the township, we called you by what you are. We don't care. I'm sorry, I'm going to say it. If you have TB, you are Mr. T. They know you cool, it's okay. It's not like we are, hey, Mr. T. Oh, yeah, my man, what's up? Hey, Mr. T, how are you doing today? As you can see, man. That's how you are. Everything we talk, if you are big, you know. Hey, Stulda. How's the ngala? That's how we are. Even if you're sitting on a wheelchair, hey, Mr. Shaman, they call you everything. Shapasin, he is a hey, Shapasin. You know, it's Shapasin. You don't even belong to any organization, but you suddenly a Shapasin. Thank you so much, ladies and gentlemen. My name is Fly Motion.
Fly Motion, o ka re o lebetse mapedi, nna ke mopedi thobela. Le kae na? Rona. I just want to take this moment to also just acknowledge my mentor and my boss, Professor Helen Rees over there. So, delegates, it is a privilege for me to introduce the next speaker. The next speaker is the one and only Premier from KwaZulu-Natal, Ms. Nomusa Dube-Ncube. Nomusa Dube-Ncube is from KwaMashu. The MEC is coming up. Well, then it's my privilege to introduce the MEC, Nama Gugu Simalani. Thank you.
Thank you very much, Program Director. I thought I should save you the embarrassment. Fly motion, comedians are the most politically people abangenandaba. You know, they say some of the things that we will never be able to say. Thank you very much, Program Director. Greetings to Dr. Maimela and Dr. Tato. Greetings to the Minister, Dr. Joe Patla, SANEC Co-Chair, Steve, Comrade Steve, Deputy Ministers, Minister Mohaule and Minister Bukhupane Zulu, all the MECs. MECs are here. They are here. We should not be the last ones to be recognized. Welcome, MECs. Mayor of eThekwini, with all the councillors, and I believe that the Deputy Mayor is also here. Professor Kollega Mlisana, UNAIDS representatives, Mr. Nelson and Ms. Winnie Bianyima, panelists, representatives of South African SANEC, representative of all 8 councils from all over all provinces, stakeholders, all stakeholders in the fight against HIV, AIDS, and TB, health workers, members of the civic society, distinguished guests and delegates, ladies and gentlemen, good afternoon. It gives me a great pleasure to officially open and be part of making remarks on the 11th South African AIDS Conference on behalf of the Premier of KwaZulu-Natal, Utatewetu Mama Unomsatube Ncube, who could not be with us because of ill health. It is indeed an honor for me to add my voice in welcoming you all to our warm, friendly, and beautiful city of eThekwini, as the mayor has welcomed us. We know that many of you will not go home without spending some time at some of our beautiful beaches. Even though the sun has been a little bit shy in the past few days, Kotwa, our winter is certainly not the winter, or it's not the same as the winter of Gauteng, so you will definitely have an opportunity to go and swim. Some people come to the province, and when they go to the waterfront, bayokamanzi olwandle, and they bring 5-liter containers to take home with them. We will not say anything about the environment and the cleanliness of the water. The only thing that we will say is do not finish our water, because we would also like to take a swim afterwards. However, you are welcome to dip your toes in them. When we drink the water, they are actually, you can't just drink them as they are. We should be able to warm them a little bit so that any infection ingabi khona lapho. On a more serious note, it is indeed a huge honor for me to address such a distinguished audience representing various sectors and disciplines as we continue to march forth in our collective fight against HIV and AIDS. Honorable Minister, being in these surroundings evokes a sense of mixed emotions owing to the fact that this is the venue which hosted the first International AIDS Conference in the year 2000, which emerged with groundbreaking resolutions in stemming the global tide of HIV and AIDS. The conference, which marked a watershed moment in the global war against the pandemic, was attended by more than 12,000 delegates from all over the world. It was a historic conference in many ways because it underscored the devastating impact of the HIV and AIDS wave, which at the time was sweeping through the sub-Saharan Africa. Program Director, that conference was preceded by the signing of the Durban Declaration by scientists and doctors, a development which confirmed scientific evidence that the HIV virus was indeed the cause of AIDS. We have just, ladies and gentlemen, this morning we have just been to the Gugu Dlamini Park, which is located a few hundred meters away from where we are. This park immortalizes one of the first victims of the stigma of HIV and AIDS in this province, who was stoned and stabbed to death in a gruesome orgy of violence. That incident remains an indelible stain in our collective conscience as a country, but certainly as a province. The Kukutlamini Park stands as a poignant and painful reminder to the difficult journey that we have traveled as a country in the fight against HIV and AIDS. Since the discovery of the disease in the early 1980s, more than 40 million people are believed to have died from HIV globally, while a further 38.4 million people are currently living with the virus. As we remember Kukutlamini and countless South Africans who have died from AIDS, we should also pause to reflect on how things used to be and celebrate the massive progress that we have made thus far. We must never forget how AIDS used to ravage our societies. Before the availability of drugs, abantu bakithi babegula baze bashone with no help on site. They would get very sick and develop all the symptoms that made everyone start speculating what they were suffering from. This would indeed strip our people of their dignity. As if that was not enough, they would go on to stare death in the face while full of helplessness before eventually dying, because there was no antiretroviral treatment available at the time. Our cemeteries became battlegrounds for burial space, bursting with groups of sad and heartbroken people burying their loved ones every week. But today, it is no longer the case. From waiting until people's CD4 count dropped to 200 before they got ARVs, now you get initiated on treatment as soon as you test positive. We as a province even have a program that we take to the people, an outreach program we call Isibhedlela Kubantu, and even on that program, we are able to initiate people on the spot because it actually goes to communities. Honorable Minister, we are reminding this conference of all those developments because we want to emphasize the journey that we have traveled, both as the global community and the country itself in the fight against HIV and AIDS. It is through our concerted efforts led by the government of the African National Congress, working with our social partners, that we have witnessed significant advancement in the fields of HIV and AIDS prevention, treatment, and care. However, we must also acknowledge the challenges that lie ahead. While we have made these tremendous strides, we still face an uphill battle in achieving our ultimate goal of an AIDS-free generation. The burden of HIV and AIDS continues to impact our communities, particularly in the province of KwaZulu-Natal. It is mainly in this province that we must redouble our efforts and have started to do so, renew our commitment to ending this epidemic once and for all. We are very much aware, Minister, that if we don't do this as a province, it means the infection rate in the country will continue to be very high. In order to achieve this, we must adopt a multifaceted approach that encompasses prevention, treatment, and improve access to care. The prevention remains our strongest weapon in the fight against HIV and AIDS. We must intensify our efforts to promote awareness, education, and access to preventive measures such as condoms, voluntary medical male circumcision, and pre-exposure prophylaxis. It is imperative that we reach those who are most vulnerable to infection, including young people, men who have sex with men, sex workers, the LGBTQI+ community, and people who inject drugs, people living with HIV, as well as people in our correctional services. At the same time, we must ensure that those living with HIV and AIDS have access to comprehensive treatment and care. This includes expanding our ART programs and strengthening our healthcare systems to provide quality services to those in need. We must strive for universal access to treatment regardless of one's socio-economic status or geographical location. It is through equitable access to treatment that we can truly leave no one behind. Furthermore, we must address the social determinants of health that contribute to the spread and impact of HIV and AIDS. Poverty, inequality, gender-based violence, and stigma remain significant barriers to progress. And it is very unfortunate that in 2023, we are still speaking about stigma. We must work together to create an enabling environment that empowers individuals, particularly women and girls, and promote their rights and dignity. Only by addressing these underlying factors can we truly achieve lasting change. At this point, I wish to appreciate the leadership of SANAC, as chaired by our Deputy President, Honorable Paul Mashatile, apologies. Well, I suppose in KwaZulu-Natal, Mashatile turns and becomes a Shabalala. I must look at Itagazelo Zabo, then you know there must be a link there somewhere. Deputy President Paul Mashatile. SANAC has continued to ensure that we continue to have a common purpose and approach towards the implementation of our strategies in the fight against HIV and AIDS pandemic. Our common purpose should remain mounted on South Africa's efforts to end AIDS by 2030. Through tangible and practical action, we must reverse the narrative that brands South Africa and indeed the province of KwaZulu-Natal as the epicenter of HIV and AIDS in the whole world. Over the next few days, we should ensure that this conference forms strong anchors of a South Africa that is responding positively to the 1990 goals and the United Nations General Assembly's political declaration on ending HIV and AIDS. Ladies and gentlemen, we are encouraged as a province that in some parts of KwaZulu-Natal, we have met indeed the 2020 UN AIDS targets, and we know that we have moved to now 95. However, on 90, we have 90% of all people living with HIV must know their status. 90% of all people diagnosed with HIV infection must receive sustained ART, and 90% of all people receiving ART will have viral suppression. And this is a message that we send to our communities on a daily basis. I am pleased to report that 4 of our 11 districts, namely Umzinyati, Umkanyagute, Uku, and Herikala, have all met these targets. Unfortunately, had it not been for COVID-19, we are sure, Minister, that we would have been reaching 95 by now. However, it does not help us to speak about COVID anymore. We are working to make sure that we reach the targets that we have to reach. We are encouraged by the fact that 96% of the people of KwaZulu-Natal know their status, while 83 are on ART and 93 are virally suppressed. This is good progress, but we are under no illusions about the journey ahead. Through the KwaZulu-Natal Multisectoral Provincial Implementation Strategy for HIV and AIDS, STIs and TB, we have begun to implement the relevant strategic goals. We reported on the progress and interventions that we have made in this regard during the Provincial Council on AIDS on the 17th of May this year. Minister, I want to also indicate, having said that, one of the challenges that we have picked up are the fact that our messages, it doesn't look like messages, our messages are reaching the young people that we want to get to. And as a province, we've had to go back and relook at how our messaging is getting to young people. Do we still have relevant messaging, and why are young people still getting infected today? In the past 2-3 weeks, we have found a number of teenagers that are not just falling pregnant from the ages of 13 to 15, but are getting infected in that particular age group. A serious worry for this province, and it's something that we are working on. We have, however, discovered that it looks like our messaging on HIV and AIDS is now stale. The messaging that is out there is the same messaging that was given to us when I was a teenager. We need to change that. The messaging that is out there and we are dishing out on HIV and AIDS is messaging that is no longer relevant to young people of today. We need to change that. We have to be straight to the point when we talk to young people. We have to be straight to the point on what is it that we want them to do and what is it that they need to do to keep themselves straight. Some of the messages that we have started to put out as a province are saying, and most of them are in isiZulu because we do want to get young people to understand and we want to start a conversation. We have one message that we have put up that says, Iskun siyabulala. Iskun. Yes. It's a message that is on our billboards. Iskun, yes. The intention of that messaging is that young people must be able to read, have a discussion, and we really have been able to start a serious discussion because adults are very angry about that messaging. Young people are asking us, what are you talking about? Therefore, we have started a conversation, and is what we wanted to do. We have another billboard that says, Sogalami kupaisi soga fagi condom. So each and every community and sector must have a message that speaks to them in a manner that they understand. And that is what we want to do, and that is what we need to do for us to be able to reach young people. As we conclude, we wish to emphasize that we have a collective responsibility to ensure that as partners, we expand access to prevention, treatment, and care to all vulnerable and marginalized groups so that they can also play a meaningful role in our efforts to end AIDS by 2030. We must leave no one behind. Sustainable funding remains critical as we scale up research and introduce new technologies. This conference, just like the 2000 International AIDS Conference 23 years ago, should mark yet another turning point in our war against infections and the spread of HIV and AIDS. With those words, I would like to declare this conference that you are welcome. I can't declare the conference open, it's the minister's work. You are welcome to the province of KwaZulu-Natal, but I wish to emphasize on behalf of the Premier of KwaZulu-Natal that this province is committed in ensuring that we reduce the infection of HIV and AIDS and make sure that we have dealt with it by 2030 as it is our target as a country. Thank you very much.
Thank you, SABC. Since I called you Premier and then you called Paul Chabalala, I guess we're even. Right. Without wasting too much time, delegates, we are running out of time. I'd like to call the next speaker. She is Miss Kholi Buthelezi from Sisonke. And she's an activist who found Sisonke, a South African movement for sex workers, all diversities. Kholi will be talking about the long journey to near freedom, decriminalization of sex work. Over to you, Kholi.
Funa ningibone kahle. Ngwabuthelezi sibonga. Sheng. Sanbonani dumela ngabshen. Goeie môre, goeie middag, I think somewhere. My name is Kholi Buthelezi. Already the screen, and also I just put this in case you might need to know because some people up there, I don't think that they can see. But I also want to make sure that before we end the conference, just try to make sure that you reach out to us so that we can teach you some more things around. Because the other thing is that I'm going to be touching on the topic where some people are uncomfortable to talk about, but some people are so comfortable to talk about. Because when we do this, people enjoy and they cry, and they call all sorts of names. So it's important that we talk about this kind of topics, I think. Let's just not be shy and also not to be ignored around things that we do, because this is the reality. I'm going to be talking about sex work today. So that's me. And I have been listening to all the introductions. I would not be able, because I don't have the list of the ministers and the MECs and the delegates, but I would just like to say greetings to all of you and welcome to KZN, because I'm a Zulu girl. And welcome. And I've heard the titles that have been mentioned and been said. I just wanted to remind others, because I know that some people do know who I am. I am the Minister for Safer Sex. So it is important before you leave and then you come, you engage with us so that we can tell you how it's done. I've got two messages today. Sex workers are safer sex expert, and sex workers do it better. If it wasn't criminalization, we wouldn't be having some problems and challenges. But I think together, we need to make sure that we come to our senses and make sure that the call for decriminalization, how much it is important in this country in order for us to be able to fight the HIV, but also to act because we've done that. We're doing it even now. That's the reason we're in this platform, because we're acting, but also we're connecting to you guys so that we fight the epidemic together. And also to end the epidemic, we need a decriminalization of adult consenting sex work. And just to say, we work with 18 years old and above. We are against the underage. I wish one of my colleagues can come and stand there with those messaging of the t-shirts that we're wearing today, so that you can be able to see the messaging, but also to see how serious we are in terms of making sure that the decriminalization it is implemented in this country. It has taken us over years to get it decrim, and it is a long journey. Time is, it was said that time is now, and for me, time is long overdue for the decriminalization of adult sex work in the country. Can we then get to the slide of my presentation so that I take through what I'm presenting to you today and why I'm here? And as you can see, I'm a human being. Sex workers are just like us, just like anyone. But if you have not seen one, you definitely get to the conversation with me. I'll tell you how it looks like and what the sex worker looks like. Oh, I should do it by myself. Okay, so which one is it, the green one? And before I proceed, I would like to thank the program directors of today, but also the extended invitation for us to be here. We really appreciate that. It shows that you are with us in this journey, and we really acknowledge that. Thank you. So I would first give the background on who is Sisonke. Is the only sex worker movement in South Africa, established in 2003 and registered as an organization to protect the rights of sex workers, particularly those working on the street, truck stop, and brothels, but also we are being contacted by some of the sex workers that are working online and in other forms of working, because our aim is to reach out all sex workers that are out there. But because of the criminalization, it hasn't been easy. I hope and still have a hope that we'll get it decrim and we'll be able to reach out to all the sex workers, because they will fear nothing to hide and reach out to the organization. The movement was founded on the premise to empower sex workers in recognizing and exercising their rights, human rights, encouraging equal access to health care and justice while we are eradicating stigma and discrimination, riddling and justice with eradicating stigma and discrimination. And the call for decriminalization of sex work has been a cornerstone of the growth of the movement. So the next slide talks about the current law on sex work in South Africa. Sex work is criminalized under the Immorality Act of 1957, which it remained the sexual offense of 1957. I was not even born, let me just tell you that. But here I am, and I'm fighting and I'm advocating for the rights of sex workers. And there's so many of our fellow sisters that I think they've died due to the HIV, because 1957, compared to the history that was presented today around the HIV, how it was started, there was no medication. I was just sitting there asking myself that, how many of our fellow sisters that have died due to AIDS, because the stigma has been playing a role. Even today, we're talking about the democracy and the progress that we have made in the country, but we still have our fellow sisters that they've challenge in terms of accessing the healthy facilities and also same as the legal facilities. The 1957 Act, it also prohibits all the aspects related to sex work. If Antwami, Umawa, Kumzawam, Abantuanabam, they know what I'm selling sex, that means they're also recognized as criminal as per the current law in South Africa. This is an apartheid era. And it continues to criminalize sex work and all forms of sex work and associated activities till today. And we, as a country, I think we've made progress, but also at the same time, we're saying we're in the democracy country. And I have not seen that, and I have not experienced that with my fellow sisters and my fellow brothers. So which is why we're calling for the decriminalization, but also asking for your support, all of you, to say, let's push the agenda of the decriminalization, because it is not, totally not about the sexual intercourse, because people are having sex and having sexual intercourse in any way. And some of you even scared to say the word sex. So how can we fight these challenges that we are facing? Because people are not even comfortable to say penis even with doing the educational awareness of HIV and all those. They'll say that thing. And there's nothing, there's no such a thing. Everything, it has a weight. So I think we should then start to move away of being shy on talking about the issue of sex work. I think the difference between the general community and sex workers, it is because sex workers exchange sex with money. That's how expensive they are. So that's the difference, you know. And within our communities also, we are not shy to talk about the sex work related topic, because it's something that people are engaging with it every day. As we're sitting here, people are doing it. But why are we shy as a country then to talk about these kind of things? And why are we choosing to have these kind of laws, punitive laws, that marginalizing sex workers whom they've made the choice 18 and above? But when people in the township, they've got 4 or 5 boyfriends, it's okay, because I'm from the township, believe me, I know how it works. You started to have a boyfriend on the 15th, that is teaching. You had to have a boyfriend that works at liver ponds. We call them liver ponds, liver brothers. And you start visiting a boyfriend on the 18th to 19th because he's getting paid. And we've got people that work for government that will get paid in different days. NGOs, 25th, by 22nd, we lovey-dovey. That's the reality. That is the reality. And it is okay for people that are in the general community if they're engaging in the sexual intercourse in this way. And there's no practice of a condom at times, because you must show the love. But believe me, sex workers, they've got authorities to practice and also to negotiate for condom. Besides those clients that they'll pretend to be clients, but they're advantage takers, then they'll start raping sex workers. That's how we become to be at high risk of being infected of HIV. But we need the support, because then sex workers have chose. It is the choice that they've made. We need to be supported in order for the decriminalization to be implemented in the country, so that we can be able to fight the HIV. The additional several municipality laws are misused by authorities to prevent the sex workers from occupying public spaces. Because even if you're standing on the street, you get to be called and questioned. Empty your bag. You empty your bag, the condom is there. I've got condoms in my bag. I was just thinking that today I might be arrested, but I can see that I feel protected, because everyone here is talking about HIV, so definitely we must have condoms. I've got it in my bag. Shit happens. Excuse my French. I can be raped. I can be able to approach the guy to say, can we use the condom at least? But why I should be arrested if I'm carrying the condom in my bag? So if I were to start from here and then till the corner, then check who has condom today, can we be arrested all tonight? And then I'm sure definitely the Durban police stations will be packed. The sex workers are also fined for loitering, arrested and detained without being formally charged. These are the challenges that we face under the criminal law, current law in South Africa. The slide talks about the decriminalization of sex work. The call for decriminalization of sex work by male sex worker, Shane Pease, whom is late. It's an old and a South African democracy. In 2003, that's when Sisonke was given birth. A sex worker movement was launched at the second national sex worker movement, sex worker meeting in Worcester, that is in the Western Cape, as the leading human rights organization in South Africa. The movement was founded on the premise to promote and protect the health and the human rights of sex workers, or our fellow sisters and brothers. And the purpose of the movement at that time to date was to develop national solidarity, as you can see, amongst the sex workers, and became more organized in response to the issues that we face within the working environment, such as the HIV, human rights violations, and other issues that sex workers are facing. The slide continues. In 2011, the South African National AIDS Council adopted the sex work sector, which we acknowledge up to today, and I see that it is CEO, Steve, and I know that there's lots of comrades from the civil society that are here that have been supporting us And we really appreciate your support because if it wasn't that, we wouldn't be standing here today. 2016, the first comprehensive sex work, HIV, TB and treatment care plan is launched through the consultation with the sex workers. And this was launched by the current president, Ubabu Cyril Ramaphosa. If you remember the history, that's when the plan was launched. In 2019, the second comprehensive sex work, HIV, TB and treatment and care plan is launched with acknowledgement of the decriminalization of sex work to end HIV and TB and STIs. Izandla bakwethu. Ngiyayithanda. And therefore, it is difficult to implement such progressive of the development implementation of the plan in the countries because of the criminalization. And I feel like we're just wasting resources, we invest into nothing. So definitely the call for decriminalization, I think it is important so that we can also see progress because we also want to see the results. We continue. The 2022 Justice Minister Ronald Lamula announces the bill set to decriminalize sex work for public comment until the 31st of January, which people felt that was a short time for that. But I also felt that we had to meet the deadline because we had to push and make sure that the bill, it is at Parliament, but also there's a comment that needs to be made in submissions. In June 2023, without consultation, Minister Lamula has halted progress to decriminalize sex work. This proved the lack of government to address gender-based violence and femicide, in brackets GBV, equal access to health care and justice, economic and freedom of choice association for sex workers by our ruling party and its cabinet. This is how far yet near we are to decriminalize sex work. I'm sure you got that. I can repeat. This is how far, yet near, we are to decriminalize sex work in South Africa. The impact of criminalization, I think this is important that you listen and it will be a takeaway home, but also I think it will also change your mindset in thinking around the sex workers because sex workers are human beings. All we need is the human rights. All sex workers need is human rights because all the rights that sex workers are asking for is the same right that you are also exercising. So the impact of the criminalization, the current legal frame, it is consistent with the international, regional and domestic laws, including South Africa's own constitution, in relation to violence against women and gender equality. Criminalization of sex work leads to stigma, discrimination, disproportionate violence against sex workers and creates an enabling environment for law enforcement officials to abuse their power. The complete of the decriminalization of sex work has proven to reduce posing as clients and intimate partners. It contributes to the elimination of the stigma and discrimination, which is a barrier to our members in accessing justice, economic and health care services. The continuation of the law enforcement practice which use the carrying of condom, I think I've said that earlier on, is evidence, but the surprising part is that when you get to court, the story changed. It creates an environment where sex workers are at high risk of acquiring HIV and STIs. The stigma and discrimination against sex work, it also makes it difficult for sex workers to access PEP, PrEP from healthcare services, even when they have experienced sexual violence, including justice. The next slide, where to find us. Take note of this because I really wanted everyone in this space to start engaging with us around the issues of sex workers so that we can be able to see how do we overcome the challenges that sex workers are facing, but also as well as what are the implementation, because we are the only sex worker national movement in South Africa, the biggest, that knows where are sex workers, how do they operate. So in order for you to be able to access sex workers, but also to do the implementation of better services for sex workers that are friendly and also accessible to sex workers, please do contact us so that we can together work hand in hand in order to make sure that we end HIV epidemic in the country, because sex workers are our fellow sisters. You're sitting here, you might find out that your cousin is in Durban or is in Joburg doing business, but we never even give a call to a landline to say, call me cousin when there's something happening at home. So I think it is important that also to have this thing in our heart that even if that person is not my cousin, but if I see a sex worker on the street, she's my sister. Today I've listened to so many panels, a presentation, which I'm touched and moved So I connect with each and everyone's story that is shared today, or is presented today, because I am a human being and I still have the heart to feel for other fellow sisters and brothers. And some of the things that I just wanted to highlight, I make note of that. I sometimes feel that in South Africa we're talking about democracy, but it sometimes feels like we now let the sex work agenda to be a fashion statement, because it's long overdue. I mean, it's been over 20 years we're talking about the decriminalization. Today there's been a decriminalization of sex work mentioned in most of the presentation, but what do? Can we then act? Because we've already started to act and form the movement. Can we then connect with you so that we can be able to end the HIV pandemic on our fellow sisters? We don't sell this information of sex workers. It is for free. Please come to us and learn more and ask questions of anything that you've ever wanted to know about sex workers, because this purpose of the conference is to bring everyone together, but also to talk and discuss about ways of achieving the HIV problem in our country. We have a stall, I think the exhibition, if I'm not mistaken, is number 72. If you walk that side, look on that, but also you'll be able to see another space, I think we offered by our funder, AFSA, but also the other one is civil society, where it says, ask a sex worker. Please go there and ask anything that you've ever wanted to ask a sex worker. I'm sure we'll be getting some responses there in order for you to leave the conference with the correct information that meets. Thank you so much for listening to me.
Thank you so much, Ms. Buthelezi. In the interest of time, I would like to once again call our next speaker to the stage, Ms. Steve Lisike. Steve needs no introduction, but as you walk through, let me just say that she is the South African National AIDS Council chairperson, which is a portfolio she shares with the Deputy President. Where are you? Oh. Okay. All right, over to you, ma'am.
Thank you. Thank you so much. I'd like to be joined by some of the representatives of civil society forum. Please join us here in the front. Halala KwaZulu Natal, halala. Viva AIDS Council, viva.
Viva!
Viva people living with HIV, viva.
Viva!
Viva women's sector, viva.
Viva!
Viva young people, viva.
Viva!
Program directors, greetings to you and thank you for steering this work. Honorable Minister of Health, Dr. Joe Pahla, Honorable Deputy Ministers, Dr. Mhaule, Dr. Honorable Sidumo Dlamini, who's here. I think in many of the introduction he was missed, but we do have Honorable Deputy Minister Dlamini, who's here. Honorable Bokhopani Zulu, who's also here with us. MEC of Health in KwaZulu Natal, Mayor Simelane, and we do have MECs from other provinces, Gauteng, Mpumalanga, Western Cape, Northwest. And these are provinces that have joined this AIDS conference. Of course, there are other MECs who will be joining us during the course of the week. Greetings to our host municipality, His Worship, eThekwini Mayor, Mr. Kaunda. Thank you for hosting us. Greetings to the UN Resident Coordinator, who's here with us, Dr. Nelson Mufu, who's Comrade Nelson now. Welcome to South Africa. And we want to also send greetings to the entire UN family. I know Dr. Kalua and Meiva of UNAIDS are here with us. Thank you so much. Colleagues, we have representatives of the SANEC Civil Society Forum, the national sector leaders, the provincial chairpersons of Civil Society Forum, who are the co-chairs of AIDS councils in the provinces, together with premiers of provinces steering the AIDS response in those levels. And these are also sector leaders who are doing excellently work in that. But I know amongst us we do have US and PEPFAR representatives, so really thank you for joining. Members of the media, distinguished delegates, comrades, colleagues, all protocol observed. It is a privilege to be part of the 11th South African AIDS Conference in Durban under the theme Act, Connect, and End the Epidemic. 2023 and beyond is the time to act, and most importantly, to take action if we want to reach the targets for our nation's own National Development Plan 2030, and ultimately the 2030 global targets, including those set within the Sustainable Development Goals. As the co-chair of South African National AIDS Council, I'm proud to have been part of the development of the 5th National Strategic Plan on HIV, TB, and STIs, 2023 and 2028, rightly dubbed the People's NSP. This is the same plan that brings us together as part of the AIDS Conference to reflect on domestic commitments and global targets. The plan's focus is of a multi-sectoral approach that guide us on how we're going to put our foot on the gas and accelerate our efforts to achieve 95 targets and speak to share the objective, shared responsibility, shared leadership and accountability. The new NSP asks from all of us to recognize the need to ensure our response is comprehensive, focused, and yield results we envisage. We do not have luxury of missing opportunities to change the lives of priority and key population. There's no time to play anymore. No. We must not miss the unique opportunity to be drivers of change in these coming years. My task this evening, I'm tasked. As much as I was called to speak on ensuring that LGBTI persons take center stage, that it does not fall off the agenda. And yes, I'm passionate about this part, like many other agendas that I'm passionate about. But why? Because it's about fundamental human rights agenda aligned to the principle of our own constitution of the country. This constitution we must guard. We must never surrender the South African Constitution. We must never surrender the Universal Declaration on Human Rights anywhere. Not in South Africa, not in Africa, and not anywhere else in the world. We have a responsibility. We've heard speaker after speaker. Our responsibility is to leave no one behind. No one sector, no one person must be left behind. But we must do it in a fast approach. We have come a long way in the address, and for us as a country to address the public health threats through the human rights lens. This was reflected during the International AIDS Conference hosted here in the grounds of South Africa, in the soil of Africa, in 2000, and also in 2016, we hosted International AIDS Conference. It has never happened anywhere else in the world. Subsequently, the National AIDS Conference held 10 times. This year, it's 11th time. But the sub-Saharan Africa is challenged by many issues that creates barriers to accessing affirmative and competent services. This includes how our legal environment looks. Comrade Colley was speaking just earlier. We want decriminalization of sex work now. We cannot afford, Minister, to hold on to colonial laws. Let them go. Let go of colonial laws that creates legal barriers for our people. Let them go. Why are we so comfortable when injustices happen under our watch? When LGBTI people continue to be humiliated, discriminated, and even murdered? Why are we so comfortable to allow sex workers to be subjected to harassment, violation by police? Why are we so comfortable when people who inject drugs continue to be harassed, stigmatized, discriminated? Why are we so comfortable when people with disability gets rejected and discriminated? Why are we so comfortable when people living with HIV are being stigmatized and discriminated? When people abuse their power, abuse the public office, public service for their own personal views. This must end now. We have seen many people become bystanders. You know yourselves, and we know you. People have become bystanders. When countries such as Uganda, Ghana, Kenya, Tanzania, and even Namibia introduce anti-homosexuality laws that seeks to erase LGBTI people, they undermine the health agenda. They undermine the human rights of those and their citizens in those countries. Injustices there means injustices everywhere for all of us. Freedom is compromised. Freedom is compromised when we remain silent. But there's a saying, we will not remember the words of our enemies, but we will remember the silence of our friends. There is an odd 67 countries across the world. 29 of those countries are in Africa. They criminalize homosexual act. But there's good news. In the last 5 years, 5 countries in Africa have decriminalized. Our neighboring country, Botswana, was taken to court. Angola and Mozambique did not need to be taken to court. They repealed their own constitution. Gabon, Seychelles, these countries are in Africa. They are showing us it's possible and it can be done. Other countries in the Americas, those who don't know the Americas, it's in the Caribbean. 4 countries have decriminalized. Let me tell you something. As queer communities, we are not interested in liberators that have become oppressors of today. And even within the health response, we want to caution those who are cushioned with resources in our names, but they are not prepared to address homophobia and transphobia. We are watching you, and we are watching the funders who fund you in our names. If you are not prepared to respond to key populations in all our diversities, leave that money. Funders who are supporting key populations, let key populations do the work. We have experts within all these different movements. We can deliver. We are smart, we are committed, and that's why we are here. Because we know those, when money is gone, they go. Let them go. Let them go. And bayeke le mali. As the SANEC Civil Society, we took a position to stand in solidarity. As civil society, as activists, as human rights defenders everywhere, we took a position to stand in solidarity. And we stand in solidarity with our friends, siblings, organizations in Uganda, and we condemn in the strongest terms the anti-homosexuality bill that was recently passed by the Ugandan parliament.
Down, Museveni, down.
Down. This bill is truly draconian, and this law is unnecessary. It will lead to even more hate crimes, human rights violation against individuals, but it will also lead into instability. Shunting people into homelessness, disconnecting them to families, their loved ones, just because of love. End hate crimes, end violations. As South Africans, many of us here in South Africa, we have a responsibility. And as responsible citizens of this country and global citizens, we should act and not be silenced. We should act and not be ignorant. We should act and build solidarity and not be bystanders. Government, civil society, private sector, development partners should speak in one voice and be the voice of LGBTI people, of sex workers, of people with disabilities, of people living with HIV, all of us, young people, older, children, stand up. Where you see marginalization, where you see oppression, where you see violation, don't be a bystander. This is the same business that you and I have committed in. It's the business of saving lives. I can speak here about statistics. Professor Kolek has spoken, and many others, MSM, the contributing incidents, and so forth. I'm not going to do that. I want us to face reality. The business of saving lives, it's committing ourselves in ensuring that this is the business of prosperity for all. We often create a social profile of priority populations. We've come a long way. Hard to reach, most at risk, now key. I'm not sure next. We have this social profile. We are here as communities, Stop naming us and giving us names. We are here. We don't want boxes. We are tired of these boxes. We know and understand our own demographic profiles, our households, our families we live in. We know. That's our daily lives. And if you cannot connect to our intersectional realities, you are missing how we can end the epidemic.
Yes.
What we've seen, Minister of Health, in the last couple of months, which I want to commend the state, the provinces where there has been challenges, the MECs acted swiftly. MEC of Gauteng, KwaZulu-Natal, Western Cape, Northwest, and now we see even with MEC of Mpumalanga. They worked in developing a public sector to respond to the key population needs, and I think we must applaud this. But this work is influenced by reports, community-led monitoring reports that have been led on the Richitsi program, demonstrating that we can do better and we can be better as people. But responding to that, the MECs did not stop. Immediately they acted, and they've been showing that leadership. And I want to say thank you for that work. Minister and distinguished guests, this morning we visited the Hillcrest Hospice, Hillcrest AIDS Trust Center, where 80% of the admitted people are in their AIDS states. The youngest admitted is a 14-year-old and a 25-year-old. We should be concerned. We should be angry. Yes. We should be worried. Yes. The youngest, 14-year-old, 25-year-old, in palliative care. It is a reminder that we are sitting on this time bomb. If our ARV program has no efficient psychosocial support system extended to care and support within palliative system, we are a ticking time bomb. My friend, comrade, Dr. Vuisega, our beloved sister who passed on a few years ago, Comrade Prudence Mabele, spoke a lot about treatment fatigue, treatment holiday. Our people are dying. We should not allow them to die when we have a successful ARV program. We can't. Let's not lose the investment where we can live longer. I was appreciative, MEC, when you heeded to the call that we will go to that center. I'm appreciative of that. I've already, for those who know me, I've already committed few people. So I will be coming to you, because in that center when I was there in the morning, I said, don't worry, I'm going to call MEC. Don't worry, Professor Zbanbang, Minister of Health, you're coming. So I'm going to invite all of you, friends. The Civil Society Forum has adopted this center since this morning. I've got a deadline. My deadline is 25th August 2023. The center will be having an event. And I've committed that we will raise resources so that we can give people admitted in that space dignity, the health professionals in that space dignity. there are success stories. Not everyone in that center, Minister, dies. People come out. And if we have to make sure that people come out of that center alive, you will join us in adopting this center. And I'm requesting all of you, join us, join me, my comrades and my friends, in adopting palliative cares across the country. Let's identify them, let's support. Later in the day, we addressed and we marched, we picketed. We launched what we call love picketing. As civil society and communities from even eThekwini, as youth and women-led communities, build solidarity, human rights defenders, people living with HIV, all of us in our diversity. We were led by young people, by youth. But as a collective, we made a commitment which our own government must ensure it also recommits. You are a signatory to the Maputo Protocol, the African Commission Resolution 275, our domestic instrument, including such which is Sexual Offences Act, and the Patients' Rights Charter, all developed for the African lives, the people's lives across the country and across the world. We must guard this. For us, there is no quick fix, Minister. Teenage pregnancy, and to some extent, we must not even shy away to call it statutory rape. It is what it is. These men are haunting our children. They must stop. They must be stopped. And if amakdoda agwelela, and you are not stopping these men because we know them, these men must be stopped. They must stop raping our children. We can't look at this other way. A 10-year-old can't be giving birth in this country. That must end. We don't have quick fix for unplanned pregnancies. We also don't have quick fix to address gender-based violence. But what is important, if we prioritize populations in all its diversities, if we put people first, I am convinced we can do better. But put youth, young people, young people. All presentations were talking about young people. I'm not the one to beg. Share the power. Create the space. Create the opportunities for young people. You will see our response will turn. Give them opportunities, our response will turn. And young people knows, earlier I was speaking to them during the youth pre-conference and I said, how many of you have even registered to vote? So sine target, Minister, sithe by November, they must have registered. But young people have built brilliant campaigns. Campaigns like Zikhala Kanjani, Rise, 1.8 billion, the EduPlus. We come from all these campaigns that we must amplify. It cannot be young people speaking alone. Join them. Don't create a new campaign. Don't replace them. Go to young people and join them. Young people want options. The ring oral and injectable PrEP. Young people want contraceptives, including hormonal replacement therapy for transgender people. Prevention is possible. AIDS-free generation is possible if we act now. You and I are a glue that can play that role, that can hold together the HIV-TB response. The most importantly, we need to act, we need to connect, and very much ensure that the people are at the center. Either we do it now, or we don't do it at all. Put people first. Thank you so much.
Tell me, baby, are you done talking? Yeah. Are you done talking? Tell me, baby, are you done talking? Yeah. Are you done talking? Tell me, baby.
The message is clear, Honorable Minister. We need to act, connect, and end the epidemic. Thank you, delegates, for your patience. I know we're running late, but we're almost there. I'd like to invite to the stage MEC from Northwest, Mr. Madoda Sambata, to come and introduce our keynote speaker. Over to you, MEC.
Thank you very much. I'm going to use what I know about the next key speaker, Mr. Mayor. Thank you very much, sir, Comrade Kaunda. The speaker that I'm going to introduce, in the team of 11, which is 9 MECs and minister and deputy, is the leader. And in the team of 11, it's 4 men and 7 women, all not gender representatives, but all of them because of quality and caliber they have. The person I'm introducing is someone who was born in Phahla. The first MEC of Health in Limpopo. The former Director General of Department of Sports and Recreation, if you don't know. The person who was responsible as Director General to bring us World Cup 2010. The former Deputy Minister of Health. And because of centrality of celebration of UDF 40, the former Provincial Secretary of KZ and UDF, Dr. Joe Phahla, the current Minister of Health.
Thank you very much. Thank you very much, colleagues. It's been a long day. It's been a long day, so let's save time. Thank you very much. As I ascend the stage, also just to remind us that I not only representing myself and my jacket, but I also represent the jacket of Our Excellency, the Deputy President of the Republic of South Africa, His Excellency Honorable Paul Mashatile. Let me recognize our host, the Premier in absentia, represented by our sister here, MEC for Health in the province, MEC Nomagugus Melane. His Worship, the Mayor of eThekwini, Mayor Mxolisi Kaunda, our hosts. All the MECs who are here have already mentioned. We've got the MEC for Western Cape, Mpumalanga, Gauteng, Northwest, Deputy Ministers present, Deputy Minister Bokopani Zulu, and also Deputy Minister Regina Mhauli. All the program directors, of course, otherwise they're going to tell me the time is up. Our 2 program directors, Dr. Gloria Maimela and Dr. Tato Chitarike. Members of Parliament from the National Assembly and I believe also from the NCOP, members of the legislature who are here, the leadership of SANAC, led here as the co-chair, Ms. Steve, and the civil society forum, the private sector, and I think, yes, I've recognized also our partners and foundation members, ladies and gentlemen, our partners also from the UN family, from UNICEF, UNAIDS, WHO also, Dr. Kalua, the country director, is always with us, our managers, various managers from the DG nationally to also the provincial, and also, of course, the CEO of SADC, Dr. Dr. Tembi Tulu, all the esteemed guests, ladies and gentlemen. As I've said, in the interest of time, we have agreed with the DP that we'll give one message to this conference. We are indeed very privileged this evening to speak at this 11th South African HIV and AIDS conference, which is held under the theme, Act, Connect, and End the Epidemic. This gathering is taking place a few days thanks to the members of the National Assembly, those who supported and those who didn't support. We thank all of you for passing the first ever National Health Insurance Bill. Thank you very much. And this morning we were presenting to the Select Committee for Education and Health in the NCOP. They are already running with the bill. This work of the passing of this bill is a reflection on the progress that we are making as a democratic government in ensuring quality and equitability of access to health care in line with Section 27 of our Constitution. As we will be marking 30 years of freedom in 2024, just in a few months' time, just over 6-7 months' time, we will be starting our celebration of 30 years of democracy. The introduction of this national health insurance is just an additional path in reflecting on the progress that we are attaining as a country in making sure that there is full equity and equality. While counting on the progress and the improvement of material conditions, we also acknowledge some of the moments and events which have led to some setbacks in our development agenda. And as already reflected by many speakers, the pandemic which we have just come out of, having the WHO declaring an end to COVID as a public health emergency of international concern, it's one of those setbacks which we have suffered in this period. And this has made it impossible for us to have physical AIDS conferences, and the last one before this one here was only in 2019, just before the pandemic struck. In line with the theme of this conference, we acknowledge that indeed it's time to act, connect, and end the pandemic of HIV and AIDS, continuing with the efforts towards the global agenda of 2030, the ambition of ending AIDS and HIV as public health threats. It is also imperative that we keep in mind that by 2025, we have to reach our 95-95-95 target, which is outlined in the Global AIDS Strategy. A new set of ambitious targets calls for 95% of all people living with HIV to know their status, 95% of those who know their status also to be on treatment, on sustained treatment, and resulting in 95% of them also being on viral suppression just in 2 years' time. In fact, in less than 2 years, because 2025 means just 1.5 years from now. As a result, ladies and gentlemen, in the remaining 2 years, we have to maybe correcting ourselves that actually 1.5 years, just 18 months. We have to accelerate our efforts in order to meet these targets. Though we have made some great strides towards achieving this 3 95s, we still have a long way, especially in the second and third 95s. I think presentations which have come earlier on have shown that we are currently at 94%, of people with HIV knowing their status. But when it comes to initiating on treatment and sustaining the treatment, we're still far off at 77%. And in terms of those with viral suppression, 92%, but which is not a true reflection because it's 92% of 77. So we actually have a long way to go in terms of especially the second and third. We're also lagging behind as a country when it comes to meeting all the set targets in respect of especially males and also with children in terms of both status, knowing status and also treatment. More effort is needed to place and retain more people on HIV treatment. In order to achieve the 95-95, we must initiate over 1 million people on treatment if we're going to reach this target. As we said during the launch of the NSP, we need to redouble our efforts and raise awareness about HIV and TB, also in terms of the social determinants and the social implications. We must reinforce our messages and agreeing with my sister here, the MEC, that we must reinvigorate those messages, make sure they're relevant, and also make sure that we can reach, especially the young people on the platforms which they spend their time on. We still need to invest in terms of billboards, TV, adverts, and so on, but let's not leave out the social media, because that's where they spend most of their time in. Our commitment to the task is in accordance with the realization that the goals of in line with the goals of the Global AIDS Strategy. We are ensuring that 95% of people at high risk of acquiring HIV must have access and use of combination preventative measures. Further, we have embedded many of the 10-point plan of the 2025 prevention roadmap in our own national strategic plan. The 2025 roadmap identifies 10 priority actions that countries must take to resolve the remaining gaps and rebuild momentum to end AIDS as a public health threat. This is the 10 points from the UN AIDS. Those 10 points, very quickly, is 1, to conduct an evidence-driven assessment of HIV prevention program needs and barriers, determine the country investment needs, working to ensure sustainable finance on HIV prevention, as already mentioned by my brother here, that we are one of the countries which significant domestic investment compared to many countries, but we still have to do more to reduce our dependence on donors. We must adopt a precision prevention approach, especially for key priority populations, as already said by Comrade Steve and the Civil Society Forum, including differentiated national prevention targets. We must reinforce prevention leadership entities for multi-sectoral collaboration, oversight, and management of prevention responses. We must strengthen and expand community-led HIV prevention services and set up social contracting mechanisms. We must remove social and legal barriers to HIV prevention services. They've already mentioned about the decriminalization as one of those. Promote integration of HIV prevention into essential services to improve outcomes. We have learned a lot also from COVID as it was disruptive, but also that there are times, of course, when there must be vertical programs, but vertical programs can only be important for a limited period. With time, we must make sure, as we now have exited the vertical programs of COVID integrated into other services, but also as we come back to refocus on the 2 epidemics of HIV, TB, the 3 with STIs, we must also integrate into the whole comprehensive services. Set up mechanisms for rapid introduction of new HIV prevention technologies and program innovations. Must establish real-time prevention program monitoring systems with regular reporting. If you don't have the information, how do you going to monitor your progress? So issue of reliable, credible data on our programs is very important. Lastly, strengthen accountability of all stakeholders for progress in HIV prevention. In our case, government, civil society, private, business, labor, we must all be held accountable in terms of have our clear roles and also be accountable. Building on this, let us continue to work together to successfully implement the prevention roadmap and guide our prevention, our HIV investments, and collectively reduce new HIV infections by more than 80% by the year 2025. You've already seen from Prof. Mlisana here the way in which we are still far off, especially in terms of reducing new infections. Because even as we say U equals to U, that's in terms of already in areas where we're not able to prevent. It's fine, U is equal to U, but at the same time we must work much harder in terms of prevention. The HIV-TB prevention and treatment program, as we have indicated, was severely compromised during the pandemic, but we are recovering. It challenged plans and compelled us to enhance new methods, some of which have also given us some new advantages, especially in the area of technology. We have now started to look more into technology in providing our services. Though there are numerous plans designed to mitigate the effects of COVID through those methods, we also used some of those methods we used during the COVID to continue to investigate innovative approaches in terms of provision of healthcare, including reinforcing now prevention and treatment in as far as HIV, AIDS, and TB is concerned, transforming our nation's healthcare system to accommodate the fourth industrial revolution. Moreover, to compensate for the disruption created by COVID, as government, we have also implemented the catch-up plans, both for HIV and TB, allowing for acceleration and integration. The implementation of the catch-up plans has helped us to move a step further towards meeting the 95-95 targets. We are further comforted by the fact that this conference is taking place at an opportune time following the launch of the SNP, which focuses on the HIV, TB, and also STIs for the period of 2023 to 2028, which take us further, very, very close to the 2030 targets. This strategy places people and communities at the center of our efforts to overcome inequities in the response to HIV, TB, and also, as we have said, this strategy, we call it the People's NSP. This 5-year plan provides a strategic framework for a multi-sectoral approach that is people-centered to eliminate all three, TB, STIs, and also HIV as public threats. This NSP emphasizes the need to break down barriers and also to maximize equitable and equal access to services through the resilient and integrated health systems which will guarantee the health and social protection of all South Africans. We believe that this NSP should be a game changer if properly implemented. It was created as a result of a pandemic readiness, and it delves very deep into social and structural drivers of this epidemic. The inclusion of mental health services and social support in our NSP is based on a strong association between HIV, TB, STIs, and also gender-based violence. And we've had a very brilliant presentation here by Ms. Ndlovu, which I'm sure speaks for itself in terms of the impact, the core relationship between HIV, AIDS, and gender-based violence. The plan also features an expanded scope for the management of sexually transmitted infections, including viral hepatitis, which has been identified to have a very strong link also with the HIV. As we forge ahead with the implementation of the NSP, we cannot overemphasize the importance of continued multi-sectoral and collaboration in this implementation of this plan. We believe that we can do more by leveraging our combination of strengths and resources. the active role of you have seen them, a very vibrant civil society, which keeps us on our toes. The private sector, which we just recently joined the SANAC family, which we already see some of the impact in terms of mobilization of resources. Our development partners, research institutions, and I'm sure during the course of this next 4 days, we're going to hear more in terms of the inputs arising from our research institutions, our social justice activists, such as also the people living with HIV. All of these partners are very important if we're going to turn the tide of HIV, TB, and STIs. One of the biggest lessons we learned from COVID-19 is the importance of integrated approach and also relating health services to broader social mobilization and intervention in terms of social determinants of disease. Social behavior change communication, we have already said that this is not just a biomedical issues, but social behavior is very key. So we need to invest in that and with all the partners. Treatment literacy and adequate resourcing are some of the interventions which we need to scale up. We also need to improve on access to treatment and prevention commodities already mentioned, such as PrEP and also pre-exposure and post-exposure prophylaxis, especially for our key populations, especially the sex workers who have spoken very loudly, the LGBTQI population, and also our young people, particularly adolescent girls. We have already seen from the presentation that we are leaving our young girls, and also the MC spoke about just in terms of their own observations here in the province. Now, on that note, ladies and gentlemen, this being the month of June, being a youth month, but also International Pride Month, let us also say a few words in this regard. We would like to stress again that the South African Constitution forbids any form of discrimination on the basis of a person's sex, gender, or sexual orientation, whether on the part of state discrimination or even discrimination by private citizens. Because of our firm belief that the LGBTQIA rights are human rights, our government will continue to defend and advance these rights. As we move towards the 2030 agenda, we need to strengthen self-care interventions and differentiated models of care to ensure that we leave no one behind, especially again emphasizing on key and vulnerable populations. This approach must further promote interventions that are critical to ensure service provision, which also helps with facility decongestion. These interventions include ensuring that patients who are stable are able to access their treatment closer to where they live, including at pickup points nearest to where they stay. We want to encourage the health department to continue working with civil society partners in developing and strengthening the implementation of the Welcome Back campaign to bring back and retain those who were lost to treatment as a result of the pandemic. And also as we make sure that those who have never initiated on treatment also as a result of the pandemics are also encouraged, are found and brought into treatment. Ladies and gentlemen, as part of the Global Alliance to End AIDS in Children, because we have also seen that we are leaving our children behind also by 2030, we need to close that gap. We are also sharpening the focus on pregnant women and breastfeeding women, children and adolescents in our HIV prevention programs. Another project which is very important, which is underway, we have already touched on that, is a treatment literacy framework, which aims to improve treatment adherence, eliminate stigma, the very stubborn stigma, and prejudice, so that we can encourage health-seeking behavior and increase also treatment uptake and also remaining on sustaining the treatment. It's important that we make sure that people on antiretroviral treatment keep having their also their viral load checked, so that they can continue also to see that they are still on the right track, and so that they can be guaranteed for a long life. Importantly as well, we cannot be, we know that as we have said already, undetectable means untransmissible, so the issue of more people on treatment and retaining that treatment is something which we must not compromise over. Now, if we all pull in the same direction, there is a chance that we can indeed, in the next 1.5 years, it's a tall order, but we can, as already indicated, some districts here in KZN, by the time the pandemic got on to us, a number of districts, as MEC indicated, 4 districts were already on 90/90, some already at least on the first 95, and also some very close to 95 even. I know it's not only KZN, but because we are here, we must speak more of KZN. But in other provinces as well, there are a number of districts, and we're focusing on strengthening them and making sure that more districts out of all our 52 districts can come on board, so that we can reach our targets. We're looking forward to a very fruitful week of very robust discussion with all the research papers, also not only on the academic side, on social side, with also in terms of all our sectors, from the civil society, from the business and labor, and all the contributing towards the robust discussions over the next 4 days. We are very confident that the discussions which will be happening over the next 4 days will contribute very highly, especially from the scientific point of view. We will continue to enrich our interventions and make sure that we can only get better. We can find more and better and quicker solutions. So indeed, this is the week at which we are committing to act, to connect, and also to end HIV and AIDS as an epidemic. Ladies and gentlemen, it's my pleasure at this stage to declare this 11th South Africa AIDS Conference officially open. Thank you very much.
Thank you, Honorable Minister. Delegates, my co-chair, Dr. Tato, we thank you very much for your patience. How was that, hey? This opening has now set the tone for the entire conference. So we just want to thank all the distinguished speakers for their presentations, for their participation. We just also want to note that even though we may joke about certain things, we take very seriously